Hi, guys. Can you guys see me? Let me know. Hi. Oh my gosh. Hi. How are you guys? I just posted a video, but I was like, you know what? Wait, I don't even, oh, my computer's not plugged in. But I was like, maybe I'll just do a little video or like a live because the video that I filmed was like a week ago or like a little bit ago. Oh my gosh. Wait, this is so cool. Hi. You guys? Oh my gosh, wait, this is crazy. Okay. And I just wanted to give you guys like an update, I guess. I posted on like my community page that you guys are so sweet that I had my finals this week and I passed both my classes. I'm done with pharmacology for nursing school, and I got a B in both classes in my Med Surg 3 class and my Pharmacology 3 class. I'm so happy the final grades are in. So now I have a week and a half off for spring break, and then I start my OB and my PEDS rotation, which I'm so excited. And my workload is a little bit less because it's a lot on our own time doing the lectures and stuff. It's like pre-recorded. So I only have like 1 day of clinical. So hopefully I want to try to like upload weekly, hopefully. You guys, oh my gosh, you're so sweet. I'm gonna go through. Let me look at these comments. I hope you guys are all doing well too. Let me see. You guys are so nice. 142 people are watching.
Oh, really?
I'm at Antonio's house. You guys are so sweet. So yeah, so school is going really good. Dallas, Texas. Oh my gosh, I've never been to Texas before. Um, Elizabeth, you start nursing school in September. Good luck. Australia. Oh my gosh. Um, Canada. So, am I gonna post a work vlog soon? So, I used to work full time as a PCNA, which is a nurse assistant in the hospital, and then I went to part time. And then when I started nursing school, I did PRN, which is like as needed, and you go in like a certain amount within like a time frame. Being honest, in nursing school, I really try not to go into work because I just don't have the time management skills to work a 12-hour shift. And I'm lucky that I don't have to go in. I do still live at home, so I don't have to pay rent, but also YouTube is my job. So, or like one of my jobs. So I really try to focus on YouTube when I am in school because it's something I can do from home and I really, really, really like it. And I know I've been like MIA for the past 8 weeks, but it's because I feel like these past two classes that I had and then last semester too, second and third at my school are like really intense. So I wanted to, really focus on school because I have a lot of pressure on it. No. Um, So that's why I haven't posted a work vlog, but because my schedule is getting a little bit less crazy, I'm gonna maybe try to go into work soon. And if I do, I'll definitely vlog. There's a lot of shortages at my hospital due to COVID. So they always need help. People are in Maryland. This is crazy that you guys are like all around the world. Um, oh my gosh. Hi, Anna. Matthew's from Texas. Um, Someone applied to nursing school. That's so exciting. Good luck. Someone's in California. I'm so jealous. Um, let's see. Thank you guys so much. You guys are so sweet. Um, I think the comments are delayed, so I'm trying to go down. You guys are so nice. I hope your guys' semesters are going well. Oh wait, let me see here. It's so crazy. People are like from literally all around Chicago, Wisconsin, Australia. We have a lot of people from Australia on here, which is so cool. Um, You're an accounting major, Natalie? That's awesome. My mom is an accountant, and I could not do that. That seems so hard. And when I was at OU, I had friends, my roommates were in accounting, and the work that they had literally like 5 sheets of like, it was like one problem. I could not do it. I give you so much credit, but thank you for watching my videos that you find interesting. Um, oh my gosh, good luck waiting on your acceptance letter. Oh my gosh, someone's from Jamaica. My parents went there for their honeymoon. South Carolina. I love South Carolina. Um, Michigan. I've been to Michigan before. A pre-nursing student in Philadelphia, dying in AMP1. Yeah, anatomy is a lot. I'm sure there's a lot of people on here who have taken anatomy, so definitely share some tips and stuff too for Alyssa, because yeah, it is hard. Um, but you definitely can do it. Oh, good luck, CJ, with your practical for nursing or for AMP. Are your guys' classes in person? Are they online? Are they mixed? Let me know. Um, oh, that's so nice, Candace, that our nursing schools both use the same nursing school textbooks. I really like the textbooks that we use. Um, how's microbiology? So I took micro. I took it in springtime of March 2019. So it was before the pandemic. It was in person. My instructor was such an awesome guy, but he wasn't the best teacher. But I actually learned more in lab, actually like seeing the organisms grow and stuff and the bacteria. And I was like, okay, it's making more sense now. I think I got a B in the class. I was super nervous about it, but I thought it was pretty cool. Okay, so someone has, let's see, online and clinicals in person, fundamentals lab in person. Hi, Lexi. Oh my gosh, I know a lot of you guys from Instagram, and I love, wait, here's Antonio. This is my boyfriend. You guys probably see him in all my vlogs. And I give you a Travis Scott vibe. I don't know if that's a compliment. Oh, that he or me? Oh my gosh, someone's from Scotland. That's so cool. So it seems like a lot of schools are doing so many people from Australia. That's awesome. Yeah, online, mixed. Hi, Amethyst. Your name is so pretty. Your clinicals have been in person this semester and last semester. I like can't see. I just got my lashes done and I feel like my eyes are like so heavy. You have the same Simply Southern shirt as me. I got this on vacation. I just got it because it's like a light pink, or oh my god, a light yellow, and I love it. I remind you of Travis Scott. Can you tell me why I remind you of Travis Scott? The Philippines.
Yeah, I want to hear why. I'm so curious.
And skills labs are in person, which is so nice. Bye, Kylie. I know you from Instagram and all your comments. You're so sweet all the time. Oh, this is a good Sarai. I think that's how you say your name. That's a really pretty name. How do you not avoid burnout?
Go on TikTok and lecture. That's what I do.
It says, how do you not avoid burnout during long lectures? Antonio's advice is go.
I record the lectures, and I usually don't pay attention to lectures. I'm not going to give my advice. It's probably not good, but I just record lectures and listen to them on my own time because I'm not the best at paying attention like during the lecture. So I feel like if you're just trying to focus, I mean, you can only focus for so long. So I think it's best just to record it, go back over on your own time, do it like that. But that's all I get. My lectures are pre-recorded. So like we just listen to it at our own time, like on YouTube. So that's nice, and we just take our notes, but
yeah, so we go to different nursing schools. We're both in third semester of nursing school though.
I'm in psych.
He's in psych right now. So his third semester, it's kind of weird. It's split up like 5 weeks, 5 weeks, 5 weeks. So he had peds first, and then he has psych right now. He's his first psych exam tomorrow, which you're gonna do awesome. Oh. And then his last 5 weeks are OB. So yeah. Let me see. Oh, don't even listen to Travis, but senior Instagram and just the flannels and chains look like Travis. Tracy. Let's see. So for like burnout with lectures, it's hard because sometimes you just get in the mood where you're like, I can't like sit through this, but you kind of have to. It's hard, especially when you do your lectures from home. Maybe he's in the bathroom. All of my lectures are not in person. My labs are in person. My farm lab, my med surg lab was in person, and my clinicals were in person. But then the lecture part was on like a Zoom where we all met. I'm sure you guys are all familiar with Zoom now. But yeah, so it's hard, I think, definitely to pay attention, especially because I really try to keep my camera on, but there's some days at 9 AM where I'm so tired and I'm, like, wrapped up in my blankets with my camera off, and I'm just like, "I can't." And it's hard. I'd say to try to really pay attention for your lectures is to sit at, like, a desk or in your kitchen where you can sit up and not lay down, 'cause I love sleeping and I fall asleep so easily, especially during lectures. So don't do that. Definitely like pre or record your lectures, or honestly, if you can record it, sometimes I'll like voice record it, or my professors will like film the WebEx and then you can go back and watch it. So that's what I do sometimes. It's really hard online because I feel like you definitely tend to not pay attention as much, but yeah, I don't know, maybe just sit in an area where you're not distracted. It's hard at home too. My dogs are always like crazy. It's just a madhouse. Sounds like chaos is happening, so I make sure my mic's always off. How long have we been together? We have been together for it was a year on Valentine's Day.
Yep.
So
A year
yeah,
and some change.
a year and some change. Yep, it's almost our year and I guess.
Yep.
Um, and then let me see. So I don't know if you guys are asking Antonio how psych is for him. He starts his clinical. You have clinical Thursday, 15-person clinical, so twice a week for 7.5 weeks in Michigan. That's awesome. I really liked psych. I liked psych. I didn't think it was bad. But I don't know. I really like the clinical aspect of it, the therapeutic communication, because I feel like the therapeutic part of that comes really easy to me, and I'm a very empathetic person, but at the same time, I get super emotional about things and caught up in things. So I guess maybe is that more of like sympathetic? I don't know. But um, you're in your last semester of prereqs. Good luck. I know you got to keep up that motivation, CJ. I know it's definitely hard, but you're gonna need it. Let's see. Sorry guys, these are like um, backed up. Do I have any tips for editing YouTube videos on my phone? This is questions I get all the time, which is crazy because I feel like my videos aren't even good quality. I mean, they're really not, but I film on my phone. So if you ever want to know, I film on my phone. I have the iPhone, I think 11, this one. I got it last Christmas. I think it's like the Max or something. And I think I started filming on like my iPhone 6. And yeah, and then I edit with iMovie. And I got so quick at editing on iMovie on my phone. I edit it on my phone. I airdrop it to my laptop, and then I add a little bit of more extra stuff in the iMovie on my Apple laptop. I'm so bad at editing. I want to get the Final Cut Pro, so I might get that in the summer where I have time to like mess around with the editing. You're lacking a social life right now. Yeah, me too, because of nursing school. I literally just hang out with Antonio, but we're both in nursing school, so we just like hang out and like study. Um, how do you deal with anxiety in nursing school? I'm in my junior year in OB and PEDS, by the way, a year from graduation, which is very exciting and nerve wracking. Megan, I feel that because it's so exciting knowing that, oh my gosh, like the end is near, but it's also like, oh my gosh, then I actually am like responsible to, save lives. Um, I think it's definitely hard because anxiety is something that is so hard in general to deal with. And then when you're in a major that is where you're literally having to put yourself before everyone else and take care of people, it can be really hard. And we tend to, lack the self care when we're taking care of ourselves. And I think when I start feeling super anxious, I can't focus on studying. I make myself feel sick with like my thoughts and stuff. So I don't know why my computer's not charging. I feel like it's going to die. Okay, here we go. Sorry. And I think it's really important to talk to someone about how you're feeling. I like to talk to my mom or my dad or my sister. Um, And I think it's, to just to get your thoughts out if you have like a really close friend or family member you can talk to, or you guys can even message me on Instagram. I have so many messages I still am trying to get through, but I think the main thing is sometimes you have to take a step back and be like, is my mental health worth this right now? Trying to like push through these 2 hours of studying, or do I need to take these 2 hours tonight to take care of myself, to maybe journal, write something out, like what you're feeling, get it onto paper. I think that helps. And kind of just focus, take it day by day. And I love meditating with the Headspace app. I've been using it for, I think, 3 years now, since 2018. My therapist recommended it to me. I love it, and I know a lot of people like to work out to help with anxiety. Um, I can't relate because working out makes me want to cry, but definitely meditating and praying, and I think just knowing that you're not in this alone with like nursing school and stuff, that at times we all feel this certain way. And I think it's really nice to talk to people in your nursing classes too, where you can kind of, share your struggles so you know that you aren't alone, if that helps. Thank you guys so much. You guys are so nice. I know, I love how you guys are all helping each other out. So Michaela asked, what nursing channels do I watch? So I watch, yeah, registered nurse RN Sarah. She has the cutest accent ever. I wish I had her accent. Love her. Oh my gosh, she saved me many times. But like vloggers, I watch Elizabeth. She's actually one of my friends in real life. I love her. And she's a ICU nurse. And then I watch Ashley Taylor. I love her. She's so nice. I can't wait to meet her in person one day. We talk a lot. I watch Abby. I love her too. I talk with her. Um, I watch. I used to watch Holly Gabrielle. I think I'd watch her a lot, even like when I was thinking about doing nursing and stuff. And Fatima, the Nurse Nook. Those are the ones I can think of right now. Um, so yeah. Um, let's see. Um, did you ever have doubts? Did you ever feel like maybe nursing isn't for you, even though you truly wanted this career so bad? Yes, I've definitely had doubts. I remember when I first transferred home from OU and moved back home, when I was like in the pit of like my like darkest time, my depression, my anxiety. I was thinking like, yeah, I want to be a nurse, but if I can't even take care of myself, how am I supposed to take care of someone else if I feel this way? Um, and I was just like, I can't, I don't think I can do it. And then you hear, all these stories about, oh, these pre-nursing classes are so hard. Nursing school is so hard. It's impossible. And you're like, oh my gosh, like I've always been surrounded by a group of friends who were always like extremely smart, honor roll, honor society. I think that's what it's called, National Honor Society. I have a twin sister who's like 20 times smarter than me. So I always like kind of put myself in a place of, oh, I'm the dumb friend, or I'm just not as smart as everyone else. And I think that definitely kind of got to me a little bit, but I think you have to believe in yourself. And I think the more you push yourself and the more, okay, you passed your first college class, or you passed your first pre-nursing class, first nursing class, you get this more confidence. You're like, oh yeah, like I can do this. And I think everyone has doubts sometimes, especially when you're like actually, in the middle of nursing school or pre-nursing and you're hearing all these things from other people. And you're like, oh my gosh, like, can I do this? Is it worth all like the stress? But I've definitely like had my doubts too. Even sometimes now, if I have a bad day, the rare times I do work at the hospital right now, I'm like, do I really want to do this for the rest of my life? Like, oh my gosh. But there's so many things that you can go into for nursing, not just bedside nursing. So I think that's what's really awesome about it. And we need nurses now more than ever. And I think nurses are just awesome. I think everyone in the healthcare field is awesome. And I think it's normal to have doubts. I think probably with any major too, because you're like, oh my gosh, like I'm blank years old. Like, how do I know what I want to do for the rest of my life? And I don't know. I do have a lot of friends in my nursing school who are parents, and their kids are like grown and in college, and they're like, I wanted to do nursing when I was younger, but I decided not to. And they're like, I knew it was for me. So here they are, 40s and 50s, and they're coming back to school, which is awesome. So I think, if you just got to push through, and I think with anything anyone does, anything anything worth having isn't easy. That's what my mom always tells me, and I think no matter what you do in life, there's gonna be some doubts, but, it's kind of overcoming those doubts and overcoming that fear and, putting your trust in, what you believe in, putting your trust in God and, having the support of your friends and family too, I think is really, really great. And I have extended family who's in nursing, but my mom is an accountant and my dad does like marketing research psychology. So it's hard when you're kind of talking to people who aren't in nursing. They're like, okay, like I was in college too. I was stressed too, but it's like this is a different kind of stress. But I think talking to someone who understands too what you're going through is definitely important. I don't even know where I was going with this, but yeah. Um, let's see. You passed pharmacology. That's awesome, Michaela. Congrats. Pharm is hard. Good luck on your Foley catheter return tomorrow. I definitely agree. Someone said sterile technique. That's super important. Um, Wait, that's so funny. You prayed to Florence Nightingale before exams. Um, oop, um, oh yeah, someone said they want to do a study with me. Skylar said that. I do want to film a study with me. Um, I just need to set a time where I can film it. I don't know if I have enough storage on my phone to film it. That's what I need to figure out. But I like watching those. Oh my gosh, you know who I watch on YouTube who I love? I've been watching her since she ever posted. She's a doctor now, but her name's America Revere. I wish I was her best friend. She literally reminds me so much of myself. She is awesome. And I always watch her study with me videos. Um, I don't watch Nurse Mercy. I've never heard of that channel, but I'm definitely gonna look it up. Um, Thank you guys so much. Will I ever do a video with my twin sister? Sorry, I have like a tension headache right now. Yes, I always want to film with her, but she is a very private person, so she doesn't really like to be in videos. But I would love to film with her. I'm more of the outgoing one, and she's very private. So I always try to get her to, do another video with me. I hope so. But yeah, she's actually just finishing up her internship right now. She was at a nursing home but she was doing occupational therapy, but she might do teaching now. She doesn't really like it, so I don't know. But yeah, I definitely want her in a video again. Same with my little brother. Oh my gosh, nursing with Jackie. I think I've seen her videos before. Does she have like dark hair? She's really pretty. I think I've seen her videos. She seems so nice. Oh my gosh.
What's the cookie?
Cookies. What kind of cookies? What kind of cookie? Oh yeah, those chocolate chip. Yeah. Um. mm, So someone said, "How are my farm classes?" So it's kind of sorry, my eyes hurt so bad. My farm classes are broken up into 3 semesters. So you have farm one, farm two, farm three. It's literally I'm going out. It's literally um like just the meds that coincide with what we're learning. So like we could definitely do it all in one semester, probably maybe 16 weeks, not 8. But like we just had my farm final yesterday. I think there was like 70, okay, maybe not 70 meds, probably like 50 medications on there. But say we're learning chronic kidney disease in my med surge class, it kind of goes hand in hand with what we're learning. Concepts, chronic kidney disease. Okay, and farm, the chronic kidney disease medication, stuff like that. And they separate it, but then for like peds and OB and for like my psych class, it was kind of just they threw the meds in there. It wasn't as intense as the questions for farm, but more like general. If that makes sense. And so now I'm done with farm, like actual classes, and I'm so happy because it's hard. What was your GPA in high school? My GPA, my cumulative, I think was like a 3.3. I graduated with a 4.0, but my cumulative was a 3.3 because I didn't really care about school my freshman year. And my parents were like, this is gonna, this is gonna affect you in the long run. I'm like, how is my freshman year grades gonna affect if I get into college or not? But it's that cumulative GPA. So mine was a 3.3. So I wasn't in National Honor Society, but I did graduate like on honor roll and with a 4.0 because I started taking things seriously and ended, straight A's, but not my freshman year. So that kind of screwed me over. But I know a lot of people who got into nursing school with super high GPAs, some with lowers. And, you know, if I took school and high school as serious as I do in college, I literally would have probably been a straight A student. But, you know, I'd probably go back and tell myself, 13-year-old Maddie, that. But it is what it is. Um, how was my human nutrition class? My human nutrition class was a class that I took my very first semester of college. And I remember signing up for it. I was like, nutrition, it's going to be about the food pyramid, which they don't even use anymore, I don't think. I was like, it's going to be so easy. My nutrition class was so hard. I enjoyed it, but I worked my butt off in it. Like I was like, this is like hard. And we had to do like some math in it. And I really liked it. I had a great instructor, but it was hard. And it was a 7 a.m. class. I don't know who thought who I thought I was waking up at, 6:20 a.m. I had to walk 20 minutes like across the campus, the furthest away. It was like on the edge of campus from my nutrition class. Oh my gosh, but yeah, it was hard, but it was interesting. At least the class I took. I know it's so different at every school. Some people can have like say nutrition's so easy or it's so hard or any class, but it really depends on the school, the professor. So yeah, I'm still working as a PCNA. I just really try not to go into work that much during school because I have the luxury of still living at home and I don't have to pay rent. But if I were paying rent, I would obviously, or if I had kids, I'd be more on top of it. But I did mention this at the beginning. YouTube is also work for me, so I really try to keep up with that. And I know that I don't post as frequently as I would like, but there's a lot of stuff that goes on behind the scenes. I'm sure you guys know too if you watch other people's videos, but there's a lot of like work that goes on behind the scenes. So it's a lot. I do all of it on my own, and it is hard at times because I'm trying to work with a bunch of different companies or do stuff with different nursing companies, and a lot of stuff takes a while to get put into place. And so there's a lot of behind the scenes work that goes on. So I do spend a lot of time while in nursing school also doing stuff like behind the scenes that isn't actually uploading, if that makes any sense at all. But I focus more so on YouTube while in school because I can do most of it from home or video calls or like Zoom call companies. How do I balance school and life? It's something I'm still trying to figure out, but I definitely take time for self care. Me and my boyfriend hang out. If we're both studying, we can be in different rooms, but at least we're like hanging out, I guess. And then all my close group of friends, they're all away at college in different states, so I don't see them during like the semesters. I don't go away to visit people at colleges, especially now because of COVID. But I never did before. I'm not a partier. I was a little bit at OU, but I am I'm just not. I don't know. I don't like it. But my one of my other best friends, she's a nurse in school too. So we're kind of just like, it is what it is. I like to kind of take a break from things. I like to be by myself. So when I'm like balancing life and school, I'm like, okay, well, I'm going to go buy myself dinner tonight. I'm going to go get Starbucks or I'm going to watch a murder documentary or some Netflix. That's kind of how I balance it. And I try to not feel guilty about doing things because if you don't take care of yourself and do things that you like or spend time with friends or family, you're going to get burnt out. And I'm getting better as semesters go on balancing, but it still gets hard. Um, so I give credit to everyone who's like working full time, who's a parent, who's, just awesome, unlike me. Um, let's see. Are you and your honey going to move in? So my boyfriend has his own apartment. I live at home. I really do want to my own place. I do really want to live alone, honestly, to kind of get that experience of living by myself because I've always lived with someone. Even when I was lived in Athens, I lived with 3 other girls, which was insane. But I don't know. We'll see. What brand of scrubs do you wear? I just wear. Oh my gosh, I don't know. I got the cheapest pair at the uniform store that I could find for like my ugly green ones I have to wear for work. And then I think it's Cherokee. is am I thinking of the Jeep? I don't even know. I think there's a scrub brand that's Cherokee. I don't know. I got whatever one was in my nursing school, college bookstore, but I'm definitely interested in like cute ones. Oh, I wish I could wear like baby pink or like lavender or like a yellow. That'd be so cute. Anyway, um, I do not watch Stephanie Harlow. I've never heard of her before. My favorite show on Netflix. Well, first off, I am really mad with Netflix because they took The Office off. I'm pretty sure I heard they took The Office off. I love The Office. It makes me so happy. That's something I do when I have anxiety too. I would put on The Office because it makes me so happy. Like I would just laugh. The Office, I was super into American Horror Story for a while. The first 5 seasons are awesome. The Sinner is amazing. It's oh my gosh, it's so good. I'm not even gonna say anything about it, but just watch it. It's awesome. Justin Timberlake's wife is in it in the first season, and she's like beautiful. But The Sinner's awesome. Um, I remember like years ago, I watched The Carrie Diaries. I really liked Gossip Girl, Grey's Anatomy, Shameless. I really just don't watch that much stuff right now. I liked, oh, what was it? Unsolved Mysteries. That one's really good too. I think they have like 2 seasons out now. Um, they took Parks and Recs off. Antonio got me into Parks and Recs. Um, let's see. Um, trying to think like what else. I really like true crime stuff. So I love Kendall Ray on YouTube or Bailey Sarian or Savannah Brimer. I watch those three. So normally I'll kind of pop in watch like an hour video of theirs instead of like a series because it's hard in nursing school to watch a series. Yeah, The Sinner's so good. Yeah, that's her name, Jessica Bale. So good. It was so funny because my mom looked like her when she was a teenager. So I kept like seeing my mom. I'm like, this is weird. Um, I'll have to look into Good Girls. I keep hearing Good Girls is really good. How much does my nursing program cost? That is a good question. Honestly, I don't know. I want to say each semester is maybe around $1,000, maybe. I know that just for like we had to get a set of books and it was over $1,000, like the required textbooks. I was like, oh my lord. So that was painful, but yeah. I don't know. I think it's like 2,000 maybe per semester. And then the more classes, depending, like we don't pick our schedule, they do it for us and whatnot. You have to take the classes in the order they have it, but I think it's like 2,000. Sometimes it's a little less. And obviously it is less now for me because I paid for my books already. Like a year ago, I paid for my scrubs and stuff like that. My, I can't speak. My zodiac sign is an Aries. You should watch In the Dark. Ooh, that sounds really good. I'm gonna look that up. Do you think you'll get more tattoos? I love the crescent moon on your wrist. Thank you. Yeah, I have this one here. It's a crescent moon. It's kind of like a long story behind this one, but this one is an A for my twin sister Allison. Everyone thinks it's for my boyfriend Antonio. It is not. I'm sorry, but I would never get a tattoo. Like if I were dating someone. And yeah, so I got this on my 20th birthday with my sister, my twin sister, and then I got this one over Christmas break, December 2019. So yeah, I'm definitely getting more tattoos. I want a lot of tattoos. I like really like pretty dainty tiny ones. Yeah, I like it. I wanted this one smaller, but the lady was like, "No, we got to do it bigger." I should have done it smaller because it's kind of like obnoxious, but it's okay. My parents don't like my tattoos. um, let's see. Um, oh my gosh, hi Dre. I'll tell Antonio that you said hi. I've seen some of your YouTube videos before, and they're so good. Like your editing's insane. Um, is balancing work and part time and school possible? It's definitely possible because I have a lot of classmates who are moms or dads, work full time, and go to nursing school. And I've said this multiple times in some videos, but I feel like the people who are the busiest in nursing school do the best because I think they just have like bomb time management. and that's something like I can't, like I have to take a nap like every day. But it's definitely possible and people do it, and the people I know who do it are so successful because they know what they have to do. They're like, yeah, I got to go to work, and when I come home I don't have time to lay around, I have to study, and they just like just kill it. They do awesome. Like I'm telling you, the moms I go to school with, the guys and girls that work full time or even part time, they do so good. I'm like, whenever I want to complain, like, oh, I have so much to do. No, Madison, you don't. You don't. You don't have kids. You don't work full time. And then also, it's like you take too many naps. So you need to like not do that. um, let's see. What specialty do you and Antonio want to go into? I want to go into, I'm thinking right now, either forensics, labor and delivery. I'm hoping, I've always been interested in that. So I'm hoping I like the rotation, and then also like some sort of like plastic surgery, like injection thing. But I kind of saw this video on TikTok today, and maybe I don't know if I want to do it anymore. But yeah, but then I feel like if I go into that, if I do something with that, I feel like there'd be pressure to look a certain way. And I feel like with social media, there's already like a huge pressure to look a certain way, which is really stressful. And I think we all have our own insecurities. And I'm definitely like nitpicky about myself. And I don't want to have to go into work or like be at work and feel like, oh, well, I mean, if you can see, I have non existent lips and like chubby cheeks and, a little wrinkly here and there. Like, I don't want to have to feel like I have to fix that just to go to work and be like, oh, yeah, she's the nurse practitioner here, and you'd expect him to like look perfect. I feel like that would be a lot of like stress. I'd be interested in like doing something like that, but then at the same time, I don't know because I feel like it would not be good on my mental health personally for me. Sorry, I talk really fast. I think Antonio, we both want to do travel nursing, but I think he's thinking about, excuse me, I see you. Um, let's see. Tips to passing med surge. So Serena, I'm telling you, registered nurse RN is amazing at explaining topics. She is just so good. I didn't watch her my first semester because I was like, why would I watch someone's videos who, like, she's not my teacher. Like, but I mean, there's only so much you can teach about a disease process. It's not like chronic kidney disease is chronic kidney disease. I keep saying chronic kidney disease because I just like learned it a couple weeks ago. But I mean, the pathophysiology, it's the same. The nursing interventions are the same. And she does awesome at it. I'll literally put her videos on at night and like fall asleep to her. I'll listen to it, like the audio of it. I'll like plug it into my like Bluetooth thing or whatever and listen to it while I'm driving instead of music. And she's awesome. So that really helps me with med surge. So I have one med surge class left, and that's my fourth semester. It'll be in the fall for like critical care ICU. Um, how did I do on the TEAS test? I passed it. I can't remember my specific score. I mentioned it in my TEAS video, but yeah, I passed it. And honestly, I didn't think it was too bad. Um, what depression meds have you tried? Have you heard of Wellbutrin and Bupropion? I can't say it. Yes, I have heard of it. I am on Lexapro. Um, yeah, Michelle, my mom was always like, I think you should like live alone first, be independent. Um, let's see. School is going good, so thank you guys so much. Um, let's see. Nina Hi is asking if clinical would be hard. I was super nervous about going into clinical because I'm like, oh my gosh, I'm going to be in the healthcare setting. And that's why I got a job before I started nursing school as a PCNA, mainly because of how bad my anxiety was. And I didn't want to go in not knowing anything. But I think it helped too. But I think at the same time, you learn things a certain way, or you see the nurses you work with do it a certain way. And it's kind of like what they do in the real world versus what you get taught in nursing school. So I think there's pros and cons, but clinical is awesome. I love it. I've gotten lucky with pretty good instructors for all my clinicals. And I think that it is a really good experience. And I think you'll end up liking it a lot. I was so nervous for it, but it's awesome. You said you don't like the hospital setting in your previous video. Where do you plan on working? So I don't know. The hospital I was in for clinical, I didn't like. And some of the nurses are super awesome and helpful, some aren't, and that's gonna be any hospital. But I think I'm gonna stick with working for Cleveland Clinic. I work there now and I really like it. So, oh my gosh, Amanda, I watched the documentary on the Cecile Hotel. I actually have the last episode to watch. I had to stop because I was like studying, but that's so good. I've been fascinated with that specific case for a while, and then they came out with the whole thing about the whole like entire hotel. And if you guys didn't know, if you watch American Horror Story season 5 hotel was based off of like the Cecile Hotel crimes. And I would love to go there and like see it in person. Maybe not go inside, maybe just like stand from afar. But yeah. Um how do you retain information after the exam? Does information all stick? The information does definitely not all stick after the exam. And I feel like I really realize this when it comes to finals because I'm like, finals can't be that bad. You only have like a week or two worth of new material. And oh, my mom just texted me. She's like, "What is Sinner on?" I've been telling her to watch it. Um, but then I school for finals. I'm like, oh my god. Like I feel like I memorize a lot of stuff to a T and then it like leaves my mind. So I that's more so for farm. But then the more I use stuff and I critical think in clinical and you're piecing it together, I feel like the clinical setting, I don't know about your nursing school. We have a lot of paperwork for clinical. I'm sure a lot of people do, but when you put your care plans together and your concept maps, you're like, oh, this makes sense. So I think kind of explaining, talking things out loud, pretending you're teaching someone instead of just memorizing stuff from a book and being able to like piece it together, like this is why this is happening, this is why this is happening. That's how you can remember it more, if that makes sense. Let's see. I feel like I'm so behind on these comments. One second, you guys. You just got accepted into nursing school. Congrats, Kendall. That is so exciting. I'm so proud of you. Congrats, Olivia, on finishing your CNA classes. Um, let's see. So, what are your options for your critical care rotation? What do you want to do? Do you get to rank them? Um, so, critical care, you would think it would be like, sorry, I don't know if you can hear those. My mom's texting me, but I would think like emergency room ICU, but it is just ICU, which sucks because for the longest time I was interested in trauma and maybe I still would be, but I guess it is hard as a nursing student. What are we going to do? Just stand there and watch these trauma cases come in? Because I don't think we have the skills yet to be so like fast acting, like, okay, do this, do this. But I'm kind of like not really excited about critical care just because I mean, all nursing is a lot, but I feel like that's going to be a lot and probably take a toll on me mentally, I think. And we don't get to rank them. I think it's cool that you guys get to do that. So I took chemistry and anatomy in the same semester. I took anatomy 2 in chemistry, and what I would do is I would set like 2 hours a day to study for chem, and then 2 hours later I would study for anatomy. So I think definitely blocking out time and chemistry was harder for me than anatomy, so I knew I needed to spend more time on chemistry because it made no sense to me. Um, and for chemistry, I would look up practice problems for dimensional analysis, and I would practice those, which helped a lot because we had like weekly quizzes of dimensional analysis, which you will use in pharmacology in nursing school if your guys' school does that. I know they call it different things, but we use it all the time. Yes, I'm in a 2-year ADN program. It is considered an accelerated program because it's in 2 years, 4 semesters, and it's crazy. All of our stuff is 8 weeks, so it's 16 weeks pushed into 8 weeks, so we can get 2 semesters worth of material done in 1 semester. And maybe this is common sense. I didn't know it when I started nursing school, but when you graduate with your ADN and your BSN, you guys are all taking the same NCLEX, so you need to know the same thing. So, yeah. Um, yes, it's accelerated. It's a lot, but would you work in the OR? I've definitely thought about it. I think it'd be really cool. I've never got to be in on a surgery or anything, so I don't know how I'd feel like if I'd like get queasy or pass out. But I think it'd be really cool. Hi, and Connie. I love you so much. Oh my gosh, I miss you so much. I love you so much. How many years of nursing do you want to do before you go for your NP? So I have heard from a lot of different nurse practitioners that I work with and nurses and coworkers that I think they recommend you working a decent amount on the floor before you go to nurse practitioner school. You can still, I think, go straight through, but they recommend the experience. And I would definitely want to get the experience before going to like nurse practitioner school, but I feel like the longer time I'm off of school, I'm not gonna wanna go back, and who knows, like, maybe I'll be, like, I don't know, late 20s, 30s, like, am I gonna be married then? Am I gonna have kids then? Like, that's, like, 9, 10 years away, so you never know what happens. I'm just gonna put it in God's hands, and I'm definitely if I do go to nurse practitioner school, I want to work on a floor and get, like, hands-on experience for at least 3, 4 years before, I think. Can you explain how to start nursing school? So, in Ohio, and I think in most schools in the United States, because I talk to a lot of you guys who are in different countries, which is so awesome, I think they do it a lot differently. But in the United States and at my nursing school, again, it's different all around. You do something called your pre nursing classes, and your pre nursing classes are the prerequisites. So, there's stuff like chemistry, microbiology, anatomy, statistics, nutrition, um, and then stuff for like your BSN, like sociology, psychology, communications, and English, stuff like that, kind of general classes. So you're more of like a well rounded, I guess, individual. And after that, or you have the certain classes done, you apply to a nursing program. So it could be at the same college that you, my charger keeps coming out. It could be at the same college that you're at or a different one, and you apply for the program. And at my school, they looked at your cumulative GPA and then your prereq class grades. So, like the prereqs that we needed to have done before were an English class, an intro to like college class, like a learning community, anatomy one, chemistry, and statistics. And then we would do and then it was recommended that you took anatomy two, microbiology, and then other crazy classes in the program. I could not imagine. Like, I have some friends who are taking nursing classes with their chemistry or their micro. I could not. I finished all of mine before. But anyway, so you apply to the program, okay? And they looked at, like I said, our prereq classes, our cumulative GPA, and then our T score. And they kind of decide then. But my one of my best friends who goes to University of Kentucky, when she applied, all they looked at was their cumulative GPA, and they did an in-person interview. Oh, Ashley just texted me. Um, but yeah, so a lot of you ask for like interview tips, and I didn't have to do that, which I am such a nervous person. I'm such a talker. I feel like I would just talk like so fast, and they would be like, "Oh my god, this girl is crazy." But yeah, that's what they did. It's all different, but anyway, so you take your prereqs, you apply, and then you the program. That's kind of how it goes. So let's see. My throat is so dry. I've been talking so much. Um, what you want to do with labor and delivery? I feel like you'd be good at. Thank you so much. Again, I have no experience with labor and delivery. I think the whole idea of carrying a human in your body and like moms are awesome and like babies, like, are you kidding me? And you get to go to work and bring life into the world. Like, who no one gets to say that. Like, I'm just gonna go to work and, be the first one to hold this human being. Like, it's crazy. And so hopefully I enjoy it. I'm so excited. Like, I think it'd be awesome to deliver babies and just be like that support system to the mom. And I think if I decide to do that eventually down the road, if I decide to have kids, I think I'd be more of a better nurse as a mom as well, because you can put yourself in that position. Because, like, there's only so much you can do. Like, I know you're in pain right now, but keep pushing. Like, I know she's in pain, but I don't know what she's feeling, if that makes sense. But oh my gosh, it'd be awesome. And maybe even the NICU. I really don't know much about the NICU, but I was in the NICU when I was a baby, and my mom just said that the nurses were amazing and made them feel like they could, do this and take care of these two, tiny babies that were the size of my hand. So yeah, I'm 21 years old. I'll be 22 April 13th, which is crazy because I feel like I just turned 21. But I didn't do anything for my 21st birthday. One, because of the pandemic. Two, I don't drink rarely. Um, like at all. So, yeah, I don't know. And I'm not much of a birthday person. I don't really like birthdays. But yeah, I'm 21. Did you have to take micro? Yes, I did take micro. I took it spring 2019. Okay, so in Chile they have a nursing school 5-year program. Um, let's see. Sorry, my contacts are so dry in my eyes. Do you have straight A's in nursing school? I do not have straight A's in nursing school. I said at the beginning of this video, if you like just came on, I just found out that I got a B in my Pharm 3 class and a B in my Med Surg 3 class, and I'm so happy. I feel like a lot of times in nursing school, I know for me too and all my friends, we plug in, what grade do we have to get to just pass the class? And I feel like that's what it is a lot of times in nursing. I have one best friend, she gets like straight A's in nursing school. I wish I could be her. But a lot of people, it's like, what can I get to just pass this class? So yeah, but no, I definitely don't have straight A's, but I was really happy that I just got 2 B's. What in forensics would you want to do? I have an obsession with true crime and criminology. If I wasn't, I get this asked a lot. If I wasn't in nursing, what would I do? Definitely something with criminal investigation, private investigation, something with like law. I don't think I could ever be a lawyer. I think my sister would be the best lawyer. I'm way too sensitive to be a lawyer. But I don't know really. I'm sure there's a lot you can do with it. I haven't looked into it that much, but I don't know, something with like crime scene, or I know they have like in the ER they have nurses who test people, which is so sad, but test people who come in who have been raped. So you do that, and I think that would be a very hard job, but very interesting as well to like help these people. Um, let's see. Someone said. Um, Okay, okay, so they don't have, Katie said they don't have any ADN RN programs in Canada, so that's interesting. Yeah, so here in the United States, they have, well, actually, most schools, like if you go to like a university, it's a 4-year BSN program, so they have a lot of those, but they have 2-year ADN programs where you get your RN, and at community college, and so, yeah, that's what I'm doing. And then I'm getting my bachelor's through Ohio University online, where I work pays for my tuition, which is awesome. And yeah, but that's really interesting. I didn't know that they didn't have ADN programs in Canada, but I know they're really pushing for all people who just have their RN to get their BSN. So yeah, maybe one day they'll get rid of the 2-year ADN programs because they want everyone to have a BSN. I'm not sure, but that's interesting. Um, oh yeah, so someone said, CJ said my program is 2 years prereqs and 2 years nursing school. I should have mentioned that too. So I graduated high school in 2017. I am technically a senior in college. This is my 4th year of college. And so yeah, I did 2 years prereqs. It took me 2 years to finish all my prereqs and then 2 years to do my nursing program. So it's still like a 4-year program, but I'll graduate with my ADN. But, I'm doing 4.5 years because I graduate in December instead of May because I had to retake my concepts class, which I look back now, I'm like, "Oh my gosh, like, that was so easy. How did I not pass?" But I just didn't know how to study, didn't know about registered nurse RN, and then, I didn't pass, and then I retook it and got an A because I figured out, like, study techniques. Um Oh, that's interesting, Alyssa. So, her university, they're already part of a nursing school and they're accepted, so you don't have to reapply after your prereqs. That's awesome. What subject am I learning now? I just finished Pharm and Med Surg 3, and I'm about to start doing pediatrics and labor and delivery. How many hours did you study for Med Surg? Well, I feel like there's people who they're like, oh my gosh, I study for like 10 hours every day in nursing school and I still don't do good. And like, that's my thing. I could study for 10 hours too and not do good because I can't, no one's mind, I think, can focus for 10 hours. So I really try to like break things up. I try to do that. I think it's Pomodoro method where it's like, I forget how long it is, but you take breaks in between on like a timer and that helps. But yeah, it's hard. You really have to find what works for you. I am not a morning person at all, so I feel like I tend to focus better at night. So I'll do like my classes during the day and whatnot, take a nap, and then once I wake up, I'm like rested and I'm like, okay, I'm just gonna like grind it out from like 6 to like 12 a.m., which I need to get on a better schedule. But yeah, you have to find what works for you. It's hard. I realize that I work way better in the nighttime. And I can only do like, maybe 2 hours at max before like taking a break. I'm like, I need food, I need a drink, I need to take a YouTube or TikTok break that turns into like an hour because TikTok is addicting. Is it true that you can be a nurse with just 2 years? So they have the 2 year ADN programs, but it doesn't count like the prereq. So I think it would be a little bit more than 2 years. Like someone said on here, they did 2 years pre nursing. I also did 2 years of pre nursing and then 2 years of nursing program. So they have to take the T's or have a recommendation letter. Oh, that's another thing that people do too. Yeah, the recommendation letters. Who's older, you or your twin sister? I'm older by 4 minutes. Everyone thinks my sister is older because she is taller than me. She's more mature than me. And she just has this beautiful like bone structure that makes her look mature. Like she gets so many compliments on her cheekbones. They're like I don't even know. They're just beautiful cheekbones. And she just has a very mature, older look. But I am older, but I'm the baby at heart. She is my rock. She takes care of me and um she definitely looks out for me. She is always there for me. She's awesome. Your lashes and brows look so good. Thank you, Andy. I just got my lashes done today. And I just plucked my eyebrows today. I think I plucked them too thin though. I think I mentioned it in in the video I just posted. I did them too thin because normally they're a little bit thicker, but thank you. You have clinical tomorrow. Good luck, Krista. Hi, Lissa from Brazil. Kelly, I know I saw Ashley's video how she talked about how she loved labor and delivery. So I'm so excited. Good luck on your nursing psych final. Brenda, you're going to do awesome. And you're going to search 3 after. You want to go into forensics and do death investigating. Wow, that's really interesting. Oh my gosh. That's actually another thing. Actually, I read too that nurses can help with like finding the cause of death in like autopsies, which is like, I don't know. I feel like that would freak me out, but at the same time, it would be so interesting. Do you think there's any way I can get into a community college to complete my prereqs with it? Yeah, it's definitely possible with a 3.3 GPA. You can do it, and you're gonna do it, and you're gonna do awesome. How does clinical class work? I'm starting next semester. So clinical pre-COVID is where you go into a hospital setting or like a healthcare setting, a nursing home, a psych unit, mostly normally a hospital, and you work with your clinical instructor, your classmates. You're normally in like your uniform, as in your stethoscope. You'll have your pen light, your pens, your little clipboard, your scrubs, and you will get to assign a patient that you get to work with. And you're kind of like a little nurse's helper bee. You're doing you get to do hands-on stuff. So like in my, a nursing school where I go, you have lab, lecture, and clinical. So lecture, you learn more of like the physiology of stuff, how it's working, these disease processes. Lab, you get to use your skills. So IVs, trach care, wound care, pressure ulcer care, Foley insertion, injections, anything you can imagine, you learn in lab. And then you go to clinical once you get checked off in lab and you can start doing it on real people, which is crazy. So yeah, that's how clinical works. Grace, microbiology, I thought it was gonna be really, really, really hard, but it wasn't horrible. Like it was definitely doable. So yeah, I thought it was easier than chemistry. But then again, I thought chem was hard. Sorry, I feel like all of these comments are so like behind. I can't believe 150 of you guys are watching me. You guys are so nice. Yes, I'm also doing my BSN. Oh, my tension headache is so bad right now. I think because I've been clenching my jaw because I've been so stressed. But yeah, I'm doing my BSN, and yeah, I'm gonna start doing that like right after I graduate with my RN. I think so. In December, I'll start. What are the best farm flashcards I've been using? I just use a piece of like printer paper, and I just it's like a little chart that has like, it says therapeutic class, pharmacological class, the use for the drug, the prototype, the method of action, interactions, side effects, contraindicated, nursing implications. It's just like a printout that my instructor sent us. She's like, here, you can use this if you want. For a while, I was doing flashcards. It just depends on what works for you. It ended up being a lot. So sometimes I just type it on a piece of paper and then highlight and write notes on it too. It's easier to type. Is this live stream going to be replayable? I think so. I'm not really sure how to work these things, but I think it'll be up on my channel. When do you graduate and have your BSN RN? So I graduate in December with my ADN, and I'll take the NCLEX and hopefully pass and have my RN degree. And then I'm hoping within a year I can have my BSN. So hopefully 2022, beginning of 2023. Are you planning on doing a nurse residency when you graduate? I'm not really sure what that means. I don't know if it's like, is it like training or whatever? But I am actually, which is super exciting, I'm applying for a preceptorship for my fourth semester. Hopefully, I just found out about it and it's due in like a week. So hopefully, if I have time to get it done. Let's see. Yeah, I definitely want to do more of these lives. It'd be fun now that I have like a little bit more time. How long does it take to complete your BSN? Again, it is so different for everyone. When I'm doing it online, you can literally do it at your own pace. My one friend finished it within a year, which is awesome. But you can take as long as you need to for some programs if you're doing it through like online or whatever. I'm hoping to finish it as fast as possible. So yeah, but I think I need to work full time still. And I was like, oh, I'll just not even work and just finish my BSN. But in order for my BSN to get paid for, I have to work. So that'll be where I have to, work on time management. But I heard, nursing school is the hardest. The ADN program is like the hardest because that's where you learn everything. Where are you precepting? So I don't know yet. I find out if I get accepted and then they place us wherever it's on a med surge floor, they place us, but I don't know like what hospital or like what specific med surge floor, but I know it would be a med surge floor and we can't pick, which sucks. Let's see. Good luck, Madison, that you just got accepted. That's so exciting. Can you have acrylic nails while you're study or do clinical placements? I'm from New Zealand. Love your content. Thank you. So we cannot have acrylic nails for obvious reasons because, they can harbor a lot of bacteria. They don't even like you to have long nails. I know there was one time I think I went to work as like a PCNA and I had like acrylics on because I had come back from like vacation like 2 years ago and I just made sure I wore gloves all day. But still, I was like, oh, everyone I works with have nails and you're not supposed to. But then everyone, they're super strict in my nursing school, no acrylics. Even though I feel like some of the girls still just get short acrylics. These are what my nails look like. I get them done tomorrow for spring break. I'm going to do like pink gel. I'm so excited. I have man hands right now. But yeah, we're not allowed to have acrylics for the germ reason. But yeah, I think we're allowed to have like a light color, like a nail polish, like maybe French tips, like on your regular nails. I'm not sure. I haven't risked it yet because I don't want to get sent home from clinical. What was the highlight of nursing school so far for you? That's such a good question. I honestly think the relationships with the amazing classmates that I have, I could get like cry about it and get so emotional because you hear, oh, when you're in nursing school, everyone just becomes a family. I'm like, okay, well, I feel like I've always had trouble with making not trouble with making friends, but having friends who actually like when you're in a friend group and it's like, everyone in this friend group are closer with each other than they are me. I'm kind of the odd one out, but that's not like how it is in nursing school. Like everyone is just so, at least at my nursing school. I mean, I'm sure there's some people who aren't very nice, but I surround myself with the good people and you really do get so close. And the memories I've made with these people is amazing. Kind of sucks now because we don't get to see each other as much because of COVID, just in clinical. And, clinicals are only like 4 people, 5 people maybe. So you don't know really who you're going to be with, but you can kind of see them through Zoom. But before COVID, I would like grab dinner with like classmates and I'm like, this is so cool. Like this is so fun. Like I'm like, I feel so loved right now. And it made me really happy. And I think just the amazing professors, the patients that I met. I love my patients at the nursing home. You just build such a bond, and I think just the experience overall, growing so much as a person, I've really challenged myself, and I think it is such a beautiful process to see, individually how you grow throughout something so difficult as a nursing school and just like flourish into a butterfly or something. I don't know. I'm definitely trying to gain more confidence in the like nurse setting because I'm always like second guessing myself. I'm like quiet. I'm like, is this right? So yeah, my clinical instructor said she can see me coming out of my little butterfly shell, which is exciting. But yeah, let's see. Guys, my contacts are so dry and I don't have my glasses here. Um, I'm in my third semester of 4 semesters. Um, yeah, the relationships are awesome that you make, like, oh my gosh. And I think too, it's like weird because sometimes some of the nurses I work with too, it's like some of these people are like petty, but everyone in nursing school is so nice. And I was worried about that because I'm like, girls can be so mean. I've had my fair share of mean girls in high school and in life. And I was worried, but these women are awesome. Like, I just love them so much. Oh, they're so nice and they're so like we just empower each other and the guys in the class are so nice too for putting up with all the ladies. So yeah. But yeah, you're so lucky you get a spring break. Pitt canceled our spring break. A lot of schools, like Antonio, doesn't have a spring break. I know a lot of people, like a lot of none of my friends have spring break. So yeah, we do have a spring break, and I didn't mention this in a video, but I am going to Florida, and I know there's going to be a lot of things about like the pandemic and stuff. Like I said, I'm not a partier. My friend's not a partier. We're literally just gonna go to the beach and just hang out. We just got a little Airbnb. There's like a little backyard. So we're just gonna keep to ourselves and get some sun to being very safe. I haven't traveled or done anything since COVID, so that's what we're doing. I know there's gonna be some comments too, but yeah, so that's what we're doing. I didn't want to like, I really don't want to say anything, but I feel like if you follow me on Instagram, you're gonna see pictures or something. But yeah, I am lucky for a spring break. It's nice to kind of have something to look forward to. I need some sun for my mental health because it's been gross here. Um, yeah, we're all definitely in nursing school for a purpose. It's amazing. The people you meet are amazing. Katie, don't be scared for your clinical. It's going to be awesome. Um, I graduate December 2021. Do you prefer a nursing home or the hospital? I I don't know. I just love the nursing home so much, but I don't think I could see myself there. But at the same time, I just loved it so much. Oh, I miss it so much. I don't know. I like the fast pace of the hospital, but I love the relationships that you build with patients in like long-term care facilities because you get to know them, you get to know their family. Maybe not so much now because of COVID, but I loved it. I'm probably more so going to work in the hospital setting. Can't wait to see your graduation video. I have like the funnest idea, or the funnest idea. Funnest, that's not even a word. I have like a really cool idea planned for my graduation video, and I'm so excited. Have you worked through nursing school, trying to figure out? I do YouTube and I work PRN at the hospital, so I try not to go in. I work holidays and stuff, but it's definitely possible. People who work full time in nursing school do awesome with it. I cannot because I have bad time management. Thank you, Daisy. Yeah, a lot of schools are not having spring break. Let's see. Ooh, Anna, South Carolina will be so fun. You're going at the end of April. That's awesome. Um, I have not. Let me know if you guys. So I have not received the COVID vaccine yet, and I want to know if you guys have and what your experience is. I haven't planned to get it. I actually need to sign up for it. Um, but I've been waiting. I might get it next week because I've been waiting to kind of do it where I have a couple days off. So if I, well, actually, no, I think I'm gonna get the first one and then do the second one in like May, where like my school is done. So if I get sick, I can like not miss school. But yeah, I definitely wanna get it. Let me know what if you guys have got it, and oh, okay, so Kenzie, you didn't have any symptoms. That's what I'm really nervous about, and I think too, I get so nervous and worried about things that I make myself sick over it, so I feel like just thinking about it, I'll make myself sick because 'cause I'm a worry wart. Um, I've heard about the Johnson& and Johnson one too. I need to do more research on it. Anna, you got your vaccine, a good experience. That's what I heard too. I heard a lot about a little bit of being, like, fatigued and a little bit sore. Um, they actually my brother a lot of the schools in this area, they had school canceled, like, 2 weekends ago for 1 day, so all the teachers got vaccinated, so they did that at my brother's school. Um, okay, Mara, your boyfriend got both, and yeah, my dentist said he had gotten, like, sick when he got the 2nd dose. I've heard the 1st one's been fine for people, and the 2nd one has been a little bit it acted a little bit more had more of an effect. So, but yeah, both her vaccines, she was all good, no symptoms. That's good, Allie. I'm really happy. My grandpa and my step grandma got it too. So they are doing good. I'm really happy that they got it. Yeah, I feel like it definitely depends on the person too. I mean, I can't be like, oh, okay, these people got symptoms, these people didn't. I'm like good to go. It's definitely just how your own body reacts. Knock on wood, but I don't think had a reaction whenever I've gotten like a shot before. I know some people can get sick, but I really haven't, just like soreness at, injection site. But yeah, yeah, definitely going to get it. So yeah, I don't know. People like fight about it too. So I try not to like, I see on Facebook, I think it's just like older people too arguing about it. But yeah. Which of the vaccines would you prefer? Honestly, I don't know much about either of them. So I definitely am going to do my research before I get it. But I did hear about Johnson and Johnson coming out with one. I don't know if it is out yet. I definitely need to look through all of that. Do you plan on getting your MSN or DNP after you complete BSN? Eventually, I want to get my master's and become a nurse practitioner. Yeah, unlucky. I did see stuff about like people's side effects with the Bell's palsy. I saw someone's video and it's scary, but yeah. Um, oh, the Johnsons and Johnsons is out because I think I remember hearing about it in my clinical. They're like, yeah, they're coming out with it. Are we able to inject shots during clinical? Yeah, we are, and it's so fun. I mean, it depends on the nursing school, obviously. Like for example, I do blood sugar, like checks. This is different than an injection, but I do it all the time. In my other clinicals, I do it all the time at work, but at my certain hospital I was at, they wouldn't let us do it or give insulin shots. But yeah, so I've done flu shots, I've done heparin. So flu shots are I gave it here in intramuscular, which is the deepest. And I was so scared because my clinical instructor's like, make sure you don't hit the bone. And I'm like, she's like, don't worry, you'll know if you hit the bone. I didn't, luckily, but I was really nervous for that. But I got really good at doing sub-Q injections. Personally, I think they're easier, where you just pinch the skin and you go in around the 2 inches away from the belly button. And I've done heparin and insulin. And yeah, I haven't done an intradermal one, like the TB test yet, but I like to practice some on my little squishy guy because my little squishy, like fake skin, because I like the little bubble it makes. But yeah, again, depends on nursing school. We're allowed to. My one best friend, she's at UK, and they do all these like flu vaccine clinics and like COVID vaccines where the student nurses give it. And she's like really comfortable with it now. So, um, and yeah, I feel like my anxiety would definitely just freak out. Let's see. Someone asked, how do I feel about the stuff with Texas? I don't know much about it, but I heard that like they don't have to wear masks anymore. I don't know if that is specifically what the issue or the thing is. I don't know, but it's crazy. I think they actually here in Ohio they lifted the um like what is it called? Like they lifted the curfew, which means like bars and stuff can stay open until like 2 or 4 a.m. or however long, which I think is a bad idea. I know a lot of people who like to go out would be mad, but I just don't think it's really smart right now, at least. But let's see. Um, Oh, my sister got I think my sister got the COVID vaccine. And she gets COVID tested. She works at a nursing home or she's interning at a nursing home. She's almost done, but she'd have like 400 hours at a nursing home and they COVID test them every other day. That's crazy. Like I couldn't imagine getting COVID tested every other day. And her boyfriend gets tested like every day. But yes, I'm from Ohio. Emily, are you from Ohio? Um Do I like day or night shift more? Never worked night shift. I don't want to work night shift, but my mom says because I'm such a night owl that maybe I would do better at it. I don't know. I need to try it out first, but I just don't think I would like it. But maybe, I don't know. Someone said, my friend hit the bone while giving a COVID vaccine, and she said she'll never forget that feeling. Yeah, my clinical instructor, oh my God, my hair. My clinical instructor said, like, years ago when she was first starting out, she hit the bone and she said the same thing. She's like, you won't forget it, you'll know. I was like, oh goodness. I was like, she made me so nervous. And the patient I first gave like my first shot on, my sub Q shot, I was like after, I was like, okay, how'd that feel? I was like, I'm sorry, it's my first time. I probably shouldn't have, but she was like, you did great. I'm like, okay, good. Um, oh my God, that's awesome. Your sister lives in Toledo. My sister graduates from Bowling Green in May. My sister is taking, she's doing her whole internship this semester. I really don't know what classes she's taking, but I think she only has like her class part of her internship thing, but she's doing occupational therapy. She was doing healthcare administration, didn't like it. She was doing physical therapy, didn't like it, and then occupational therapy. But she is thinking about being a teacher now or doing something with law. She doesn't know. What is your go-to hairstyle while in nursing? Well, you guys can see my hair. I don't even know what I'm saying. You guys already know my hair is long. It's a lot. And it can get really heavy, but well, first off, in my hair ties, they get ruined so fast. They like break and rip. But anyway, my go-to would probably be two French braids. I suck at French braids. If you see my videos, it's so bad. It's not even really a French braid. But I do two French braids, the middle part, okay, whatever, like that. And then I take the two French braids and I twist them together into a bun. So it's literally like a little bun of braids and it's braided up here. If I have time to do it the night before clinical. But every time I wear my hair in a ponytail, whenever I bend down to take vitals, I literally whack my patients with my hair. I'm like, I'm so sorry. And plus, I'm not trying to get anything gross in my hair. I wash my hair every day I get home from the hospital, like as soon as possible. But I would say my go-to is definitely like two braids with a bun. But then I love cute headbands too. Etsy has the cutest nursing headbands and stuff. But if I had the guts, I'd cut my hair up to here. Like I'd cut my hair this short and just wear cute headbands. It'd be so cute. But yeah, braids and take the braids and do a bun because I still whack people with my braids too. But I got I think 6 inches cut off in October, so it's definitely shorter than it used to be. Texas lifted the mandate. However, we still have many businesses and schools requiring them, as they should. I think so too. I think it's crazy. I couldn't imagine. I'd be scared to go out without my mask. I saw a TikTok and it was like living in Texas, me going out and the person put on like 5 masks. I just think I don't know, it's so weird like leaving the house, or thinking like I just have like 10 masks in my car all the time. I have them everywhere. Um, and then I'm like, I'm like, this is so nice because I never get ready. And I'm like, this is nice. Like I can just look like rough. But then I start making, you make faces, or I've seen TikToks, people are like doing silly faces behind their mask. And it's like, what are we going to do one day when we have to take off our masks? Um, oh my gosh, Taylor, I'm so sorry you have COVID. I've heard literally horror stories, and I hope you feel better very soon. Oh gosh. Don't cut your hair. I won't. I'm too scared. My mom would kill me too. She's like, you'll regret it. Do you have an updated skincare routine? That's so funny you asked. I actually just included my whole skincare routine in my vlog at the end. I was like, let me just show them what I do for my skincare routine. Um, and you guys, if you didn't watch my video, but you've watched my other videos, I used to get really like dry, patchy skin when I got stressed. Started when I started college. and I haven't gotten it because I have used this lotion, not sponsored. I bought it with my own money. It's the First Aid Beauty moisturizer. I linked it in my video. It's so good. But if you have like stuff that looks like psoriasis, I think it is, or eczema, it has worked awesome for me. But yeah, so I did my skincare routine in that video. Not sponsored. None of that. Everything was bought with my own money. Do you take ATI? So yeah, we take ATI. Got this here in my mouth. We take like ATI stuff for practices. We had an ATI proctored farm thing. So yeah, we do ATI. I kind of like ATI, but then at the same time, I hate it. So hi Ashley, I love you. I wish my hair would look so cute like yours. Sure, every time I see you post, I'm like, her hair just looks so good, and like the color, and like when you like, you have the curls. So jealous. That's crazy, Anna, that you put in your first catheter because my hair almost fell into it. Oh my gosh, I've never actually inserted a catheter on a patient. I remove them all the time at work, which is obviously, I feel like, totally easier than inserting it. I've had some clinical classmates insert a Foley because they're kind of like, who wants to do it? And I'm like, not me. Like, I'll watch, but like, I don't want to do it. I'd be too scared. And like, again, it's so strict with that sterile field and it's hard. I'm like, I feel like a dinosaur, like trying to like not turn my back or like move my arms or anything. How to calm the nerves during clinical. So what I would do, like my whole first semester driving to clinical, I would listen to worship music in the morning. It helped me so much. And I would just like take a deep breath. I wouldn't eat anything too heavy, but I would pack like gum or mints or make sure I had water and like a granola bar to kind of help my stomach a little bit. But let me tell you, I feel the nerves. I understand that, but it gets to the point where you're like, okay, like I'm going to clinical, and I'm sure different rotations, if you're at a hospital you like or you don't like, or an instructor you like or you don't like. I've gotten really lucky with instructors and classmates. Every single one of my classmates awesome. But I think, I don't know, worship music helped me in the morning. I really like Lauren Daigle. And what is it? Oh my gosh, I forget what it is. They sing Oceans or Where My Feet May Fall. I forget what it is, but they're awesome. Hillsong, I like them. I keep hearing people like they like know when they lose the ability to smell. They're like, oh, like crap, I think I have COVID. Do you get facials? I've never gotten a facial before. I'm scared to get one because my mom said she got one time and she literally like broke out so bad after. But I feel like that's kind of like a common thing because doesn't it like pull stuff up from like under your skin? I don't know. I've never gotten one. I always see like YouTubers get them. I'm like, ugh, to have the money to like just go get a facial every week because I'm pretty sure they're expensive. But if it were up to me to go like get a facial or a massage, I'd get a massage. I've only gotten one massage before. I got it like 2 years ago after my first semester, and it was amazing. I have so much tension. My posture is horrible. So I really want to get one. Maybe I'll get one in a couple weeks. A massage. I've never gotten a facial, but if you have, let me know. And like, how do you guys like it? Thank you, Estella. And congrats. Oh my gosh, you got a nurse in school. That's awesome. And your name is beautiful. How do I study with ATI? So we actually, one second, let me grab it. Wait, let me just grab it. Okay, so we have an online ATI thing where there's like practice exams. It's like a code that you get through your school or your teacher. And then we got a box. It was like within our tuition, a huge box of the ATI books. And they have workbooks for each semester or for each class. Oh my God, I just burped. I had a hibachi tonight and it destroyed my stomach. So that's super fun. Anyway, this was for my mental health one, and I gave it to Antonio to borrow for his mental health. But what it has in here, for example, there's different sections. This one's on anxiety disorders, which is so awesome to learn about myself. But anyway, and then at the end of each section, they have like 5 questions, and they have a mixture of multiple choice and select all. And then the next page, they have the answers and rationales, and the rationales help a lot because it's like, okay, well, this is why it's super awesome. And so that we have it for each class, or for each like class. Like we have a big med surg one, a big pharm one, stuff like that. So that's kind of how I study with the AT. It's definitely helped with some of the practice ones. I graduate with my BSN. I don't know yet. um, let's see. Oh, that's nice. You don't have to pay for it, Samantha. Okay, their ATIs are only online. So I know my one of my best friends, she's a semester ahead of me. In my fourth semester, so next fall, they have like a 9 a.m. to 4 p.m. ATI live thing that they have to go to. Um, let's see. Oh, Kenzie, that's so awesome that you feel more confident. It really is like once you go to the first one, you're like, okay, you kind of feel it out. Um, Hi, Evelyn. I love you too. Um, do you still keep in contact with Elizabeth Maria? Yes. Oh my gosh, I love her. I think we were just talking the other day. Um, she is like one of the most amazing people ever. And the thing that's so funny is her boyfriend, I've known him since I was 5. We went to school together when we were little. But yeah, I still keep in contact with her. I love her. She's a lifesaver, helping me with nursing and giving me tips. And she's such an amazing person. You're so funny. Like a dinosaur. I do. Oh my gosh. ATI is tough, but it prepares you to successfully pass the NCLEX. That is good to know. That's what I hear too. It's like hard, but yeah. Oh my gosh, you guys, I haven't got lashes in so long, and it's messing with my eyes right now. I got little eye crusties. Um, do you feel like studying the ATI questions helped you on the ATI proctored? Um, I would tell you that if I used my farm ATI book, which I haven't even opened my farm ATI book. I normally used it for med surg. Not gonna lie, this helped me a lot in my mental health. I mean, I used it a lot. Obviously, with everything paged off. I didn't, and I used my med surg one a bunch my second semester, but I really didn't pull from it just these past 8 weeks. But we had my farm proctored ATI exam, and I got level 1 out of 3, so I did not do very good. I mean, at least I didn't get level 0, but I got level 1. And the thing that sucks is with the oh my god, thought I just saw like someone walk by and there's no one there. Um, the thing about ATI is it's not specific. It's more of like, it's not like I'm testing you on what you learn. It's kind of like broad. So it's not necessarily specific to what you just learned in your semester. So I feel like some of the proctor ones, it's a guessing game. And I don't think that's really fair for points. So, like, for example, if you get a level 3, you get 3 out of 3 points. I got level 1, so I got 1 out of 3 points. It didn't drop my grade a lot, but it's still like annoying. Like, what if I didn't pass by 2 points and it was because of that stupid ATI thing? When you take ATI before or during nursing school. So my school's super weird. Like we took one after my first semester. We took like a med surg one, and then we took one for farm after the end of all of our farm. So I just took one like last week. And then I know we have ones for I think peds and OB. And then I think my last 8 weeks of nursing school is like my management and synthesis class. And like all you do is go through ATI stuff, which I'm super scared about. So maybe I'm just gonna like practice over the summer. But these books are awesome. I don't know if I'm sure you can get them online. Again, they were provided through our nursing school because it was like, I guess, a part of the bundle. But we didn't even get them until the very end of our first semester. So I don't know. Any tips to pass med surge? Um, Samira, I think I follow you on Instagram. But med surge, I was saying definitely registered nurse RN. She is awesome. And I really wish I was at my house right now so I could show you guys my little concept map things. But I am going to do a video on like my study guides that I make and what kind of helps me. But definitely registered nurse RN. I'm telling you, she's awesome. She's pretty much a video on like so many topics. And it helped me so much. And teaching someone, literally, like, your dog, your mom, your dad, your brother. My brother will literally play video games, and I'll just talk to him. He's not even listening, but I pretend I'm a teacher. Also writing stuff on a dry erase board. But definitely, I feel like I've literally done. Not trying to sound conceited, but or not even. I feel like I've done better in my med surg classes because of registered nurse. And I have a med surg each semester, which is crazy because my one friend finished all of her med surg in one semester at UK, which all schools are different. I did not have to take the Hesse. I took the T's, so I don't really know how to study for the Hesse. I'm sure it's similar, but I would definitely look up videos for schools that take the Hesse. My boyfriend graduates the same time as me. We're at different schools, but we both graduate in December. How do you study for pharm and patho? For pharm, this is literally what I did for this semester, and it saved me. So she had pre-recorded lectures of each week what we're learning, and they were about 25 minutes of her going over, I don't know, like 7 to 10 meds per week, and then we'd have like a live meeting where we would discuss. I would play her lectures on loop. Like, I'm telling you, I would listen to like each lecture like 10 to 15 times, almost to where I could memorize what she was like going to say next. So then it's in my head, kind of like a song. And then if I didn't understand and needed more detail about, for example, we learn about diphenhydramine. Diphenhydramine is Benadryl, and you would think it has, because it has antihistamine effects, you would think of it for like allergies, but it can also be used for insomnia and Parkinson's. Okay, that's random. Why? Because of the anticholinergic effect. I didn't know that. So what I would do is I would go into my book and read more of. We use the Adams Pharmacology book, and I'd go into my book and read. It has an effect on. Oh my God, it has an effect on Parkinson's, and I don't even, what else did I just say? I can't even remember. Parkinson's, and obviously insomnia because of the sleepiness, but like Parkinson's and motion sickness because it has a drying effect. So it's going to literally kind of like dry up the liquid in your ears with the motion sickness. It's crazy. So I would look in for the book for that. If that makes any sense. I just have pharm in my mind, so I'm just going to show you the knowledge that I know. But that's how I study for it. I really don't go in the book unless I have to. And then I do a bunch of like practice problems for dimensional analysis because we do a lot of math in my farm. And then like patho, my patho is kind of mixed in with, it was mixed in with my anatomy, and then it's just mixed in with all my med surg classes. And again, registered nurse RN, she describes the patho at the beginning of all her videos. And then I also sometimes go back to my anatomy notes and can see, freshen up on the patho, because you need to know how the body works regularly to know what the difference is when it's working not right. You know what I'm saying? I feel like I know the information in my head, and when I try to say it out loud, I don't know what I'm saying. I feel like I sound stupid. I feel like that too a lot. That's hi. When?
Yeah.
Isn't it the 9th or the 15th or the 11th? Why?
Just curious. I can't.
It's the 9th or the 15th. No, it'd be longer than that. The 11th or the 18th? I have it in my phone. 1 second.
Oh, you do?
Yeah. Let me check. Wait, do you have my charger?
Yeah.
1 second. Oh, how did you and your boyfriend meet? Perfect question. He's in here now.
Should I say?
We met at 1 second. I have to. Let me tell you.
We met.
Aruba, July 7th through the 15th.
I wish I was on the motherfucking Aruba.
Damn, 7th.
It's cool. I'm going to Mexico in October.
You're going to Mexico? That's awesome.
We're Mexican, Puerto Rican. So.
That's so fun.
Some of us, like the family of Puerto, are Mexican, and some are Puerto Rican, but most of their my grandma's side, but they're married to Puerto Ricans.
Oh, that's so fun.
But it'll be fun. Since he's going to Vegas.
Yeah, I'm going to Vegas
for his sister's birthday. His sister's birthday. His family's going to
Your
Vegas.
21st? Oh my gosh.
So, Aaliyah, who's turning 21, my sister Alexis, her mom, their brother.
Wait, so you're going to Arizona
so
too?
She needs a road dog. I was gonna go, but we go to Aruba, so I was gonna,
Oh.
I wanted to go to because like it's like his family, and then we met at a
We
party.
met at a when I was in do you want to be on my YouTube live?
Oh man, hold on.
Come here.
Hold on, man.
We met at a party. I was just about to go to college. This was 2017. Yeah. And we met at a party, and I had just broken up with my ex at the time, and I was like, who is he? No idea who he was. I never seen him before. Wait, this is Brandon. This is Antonio's roommate.
Hi.
That's Brandon. But yeah, we met at a party, and then I followed him on YouTube. I followed him on YouTube. Not
He followed
YouTube.
me on Twitter.
I followed him on Twitter and Instagram. I never knew him. Like, I feel like you know people from your area and stuff. Never heard of him.
I'm the favorite friend.
Yeah, he's my favorite
I'm the
friend.
favorite friend.
Brandon's my
Right.
favorite friend of Antonio's. But yeah, so they're roommates. They live together. And anyway, so then I went away to college. I saw him a couple times.
So he's hi, Brandon.
For real?
Yeah.
Who?
Her name's Allie.
Hey, shout out my Instagram.
Oh yeah, wait, what's your
_Ron35.
all right, I'm gonna put his Instagram. B_ROD 35.
B_Ron35. Follow the boy.
Yeah, follow him, hit him up, he's single.
Six,
all you ladies.
6'3" hooper,
6'3"
light skin.
You're interrupting my story. Anyway, so I see him at college sometimes. I was starting college. I was like, don't really. Didn't want a boyfriend at the time. I just got out of a 6-year relationship. And then he messaged me and asked me if I wanted to go to an Indians game with him summer of 2018. And I was like, no, I'm kind of talking to my ex again. And then.
So I said it was over. At that
Yeah,
point.
so it was kind of like whatever. But he'd always like randomly Snapchat me, and I wouldn't respond.
You know how that goes.
And then, because he'd always Snapchat me. Not that I didn't want to respond, but
She wouldn't respond all the time. She'd respond sometimes.
I would respond sometimes, but I wouldn't respond because.
And then she responded. She only responded like twice. Then she would stop responding. So I was like,
oh yay! Someone said Brandon's hilarious. Someone said you two are so cute together, and Brandon's hilarious.
right.
And oh my god, this is like literally the longest story ever because I keep just blabbling. Anyway, so fast forward to December 2019. December 2019. Me and all my friends were having a gift exchange. My girlfriends were home from college, and we were just, having a, just a chill night. We were doing a gift exchange, and we, we're drinking a little. I had some liquid courage, and they were all talking about the guys they were talking to, and I was like, Antonio had posted an Instagram photo. I was like, I'm just gonna message him, and so I messaged him, and I was like, you're so cute, we should hang out sometime. And then that's how we started talking. We met up at Starbucks, and we talked until it closed. We were there for like 4 or 5 hours.
Yeah.
And then like 2 days later, we met and we went to dinner at Applebee's, and we were there until it closed. We were the last people there. The workers were literally like standing there, like waiting for us to leave. And so, yeah. That's kind of how we met. I slid into his DMs, and I followed him on Instagram and Twitter. And when someone follows you on both, you kind of know.
You can tell them they can slide in.
Slide into Brandon's DMs, ladies.
B-Rod single, man. Show him some love.
Yeah, so I'm an Aries, and he is a Gemini. I'm just kidding. A Gemini,
don't hate
right?
me now. I know that Gemini
We don't. I don't know anything about the signs. I just know I'm an Aries. I don't think I knew I was an Aries until like, I don't know, first year of college.
I don't have multiple personalities. That's the thing with Gemini. I don't have that. I don't have any of the characteristics of Gemini.
What time is it where
Promise.
you
I see, every time you say Gemini, people are like, you suck.
I feel like I'm watching Juju.
I don't know. I do. I don't think
yeah, I don't know anything about I was gonna say the astronauts, astrology. I'm a Leo. My husband's a Leo. 2 lions.
So my boyfriend, Gemini. Shout out to the Gemini.
Yeah, Megan. Sounds like my first date. I've been with my love for 3 years, Starbucks date. That's awesome. Oh my gosh, yeah. And then I think, well, something that I respected about him, I think we hung out. We hung out a lot until, like, we even kissed or
Hey,
anything.
Brandon, what's your sign? Hey, Brandon, what's your sign?
I'm a Virgo,
He's a Virgo.
the realist.
Is that a good thing or a bad
That's
thing?
a great thing.
That's a
A
good
Virgo?
thing. Virgo. Add that to the resume.
A Virgo.
Virgo, light skin, 6'3".
Basketball player. Let's see. Aries are my fave sign. No wonder I love you. Oh, I love you too.
We see you guys in 5 years.
Chantel's a Virgo too. He almost got away, girl.
Brandon, love connection.
Someone commented, Allie and
This is
Brandon have a
so-
love connection tonight.
This is so funny.
Brandon, we're finding you love. Let's
That
see.
is so.
Tell Allie to follow me.
Who said I love you first?
He said follow him, Allie.
I did, I think. No, I don't know. I think I said I love you.
He said it first. He said, no. You know what you did? We were sitting next to each other. You text me. ILY. I was like,
What did I say?
ILY.
Oh yeah, I was playing the conservative. You know, that's a nice approach. If you don't know if you want to say I love you, just text.
What do you mean you don't know if
text
you want to say it?
ILY, and then based on their response, you'll get if they're kind of uncomfortable with it or not.
Don't do that. That's what my 13-year-old boyfriend did when I was in freshman year of high
Works
school.
for all ages.
No.
What are your pet peeves?
Let's see. Wait, where do we see ourselves in 5 years? Travel nursing, maybe?
What did you?
Travel nursing?
Hopefully, travel nursing or
Yeah.
not working at all.
Okay. Oh, someone asked earlier what you want to do. I said maybe the ICU, but I didn't know.
I think I think I want to be an OR nurse or ICU, but I don't know. I think I want to be an OR nurse. I'd rather just kind of pass the instruments around and keep it at that. You know, no bedside, but I don't know.
Oh, your birthday's coming.
Take
Your birthday's coming up, Megan. Happy early birthday. Mine's April 13th, and his is June 15th.
What are your pet peeves of mine?
He is Allie's a minor. Yeah, never mind. My pet peeve of his is, well, first off, when we get food, we bring food home. He will like do other stuff, like whatever he needs to do, and then he like lets his food sit there and get cold. Like if we like bring food home, I'm like, why are you like? I brought us TJ Fridays the other day, and he was like studying, doing other stuff. He's like, well, I have an air fryer. I'm like, yeah, but like, why you sit there? And then other than that, that's not even a pet peeve. I just think you're silly for that.
I'm just really like, I don't know. It's hard for me. My attention span is very short.
I think at times
So
when you get stressed,
I just bounce from boom to boom to boom to boom. I don't think she likes it.
And then I think he's just he's a clean person, but just a little unorganized, school-wise, unorganized.
Yeah.
But other than that, that's it. That's it.
Yeah, I'm unorganized. I'm organized in my mind, but not like organized. Like most nursing students have like colored pens and organized binders, and like I just kind of throw it all in one. But it's all in my head. I memorize everything. And my study guides are very organized.
She said, Brandon, I'll text you in a year and a half.
Oh.
That's so funny.
That's funny.
Hi from California, but
funny.
From Ohio. Oh, I wish I was from California. Let's see.
That's funny. Air fryers. Air fryers are the best.
I know. My parents got one for Christmas. Your birthday's at midnight. Happy birthday. 27 minutes away.
I graduate in December.
Yeah.
As long as I keep on passing.
I don't know why some of your guys' comments keep coming through for like approval, and there's nothing wrong with them.
Oh, so where do you get the ring on your middle finger?
Huh?
So where do you get the rings on your middle finger?
I got them from Antonio. It's from Swarovski Crystals, and it's a 2-piece ring. So there's like these little, the camera quality sucks. Wait, let me put my flashlight on. it's like that definitely made it worse.
It's not real diamonds.
You can see though, and it kind of
It'll play you if you've
sits
seen it. You might think they are, but
like
they're
this. It's like this. It's
Swarovskis.
super pretty.
Swarovskis are it's called.
My Valentine's Day gifts. What keeps you motivated? I think wanting to make myself proud in the end, and obviously I want to make like my family proud, but I think more so at the end of the day, it's like I want to prove to myself that I can do this, and just thinking of like the end picture. And yeah, what?
I don't work as a PCA. Well, technically, I'm a transporter, but
What do you mean technically? You are a transporter.
but I just made the decision like 2 weeks ago to I told him to take me off the schedule at the hospital and just barely work me because my car detailing business, and that's just like that's like my job now. Like that's what I do because
Can
been going well,
Antonio come to
so
my state and detail my car?
absolutely.
He would love that. When we do travel
Of
nursing,
course.
we'll hit you up, okay?
If you want to see some great before and afters of like disaster details, if you like satisfying videos, oh my god, check out my Instagram page because like I literally have tons of them.
You can type it in if you want.
Oh, can I?
Yeah. A transporter is where you basically, they're the ones who move the beds around, and they take the patients from, say they're going from the emergency room to the OR.
Garbage of the hospital.
Yeah.
Everybody hates
No,
us.
the garbage of the hospital.
Everybody hates us. Nobody
No.
likes the transporters. It's such an easy job. You literally push people around from point A to point B, and you get to meet a lot of people, talk to a lot of people. I even have like my AirPods in while I'm there. Like literally nobody cares what we do. Like it's pretty nice when you're in school, but
Let's see.
I
Thank you,
think that's
Allie.
it.
I'm starting my first RN job next week on a. Wish me luck. Good luck. Wait, where did it go? Good luck, Lily. You're gonna do awesome. You're gonna do so good. I know it's easier said than done, and I'm not even in your shoes yet, but I'm sure it's nerve-wracking, but just you got this. You're gonna do awesome. I'm starting my second half of med surg. Any tips? Registered nurse RN. That's literally how I've been getting through. Registered nurse RN. Who's more outgoing?
I would say I can tap in, but usually I'm chilling. She's always outgoing. It just really depends.
I can talk to anyone.
Yeah, there's times where I'm just like I just
Don't
don't feel like talking. Yeah,
and I don't think it's you're shy. You just have to be in the mood to talk, and so maybe people could think of that like, oh, he's not friendly, but you're just quiet.
Yeah, like I can be quiet times, or I can be super outgoing. It just depends what my mood is, like when I'm feeling. But
yeah, I could literally talk to anyone. I could.
She speaks up for me at restaurants,
which is weird because normally I don't do that. But I literally could make friends with someone who I just met. I'd be like, oh my god, let's be best friends.
Would you guys like to travel? Hawaii.
Yeah, that would be awesome.
California.
He's never been. I love California. Oh my god, my hair is getting stuck everywhere. Someone
has always said, "Oh, quiet observing the scene." Oh, maybe I do have a characteristic.
Y'all look like Abercrombie and Fitch models. I'm jealous. Oh my gosh. Stop hyping us up. No, I'm just kidding. I mean, no, you're not. My semester's going good. I just finished my finals, so I start OB and peds in a week and a half. Good luck. Is it Jason? Good luck, Jason. I hope you hear back that you got accepted. That's so exciting. I know that waiting time is super nerve-wracking, but it'll all pay off. We ended up, the first time we met, it was at a party, and then a couple years later, I DM'd him.
I'm 23.
Oh, yeah, he's 23. He's so old.
I'm a fossil.
I'm 21. I was going to nursing school, but I still want to work as a CNA at the hospital as well. Should I work full-time or no? You can definitely work full-time if you have good time management. I know people who work full-time, but you could definitely think about if you're able to go part-time or PRN.
A lot of people do PRN.
Yeah.
But if you have to work full-time, it's definitely possible. I know a lot of people work full-time and do it. It's just, it's tough though, but
yeah.
You can do anything.
Sahira, I don't know if I'm saying your name right. It's really pretty. But I don't remember there being a lot of microbiology questions on the T's at all, actually.
I wanted to be a PA originally, but then my Got a couple too many C's, so I switched it up and went to nursing.
Oh my gosh, you're fine. He smelled so bad when he came home from work. I was like, you need to shower. I was like, he's
working man, work with my
all things fresh
bare
detailing.
hands, all things fresh detailing.
Oh my gosh, the girl Allie said that she's underage. She said she'll text you in a year and a half.
Just it is.
17 maybe.
Yeah, you go to jail.
It's like being a nursing student. I know that it's more female dominated. Honestly,
That's a good question.
It's actually a really good question. So I am so I'm usually in my clinical groups, it is mainly females, and for certain things it can be awkward, which I'm sure if you're in nursing school you see, like for guys it's a mainly female dominated profession, so like certain things are just kind of weird for me. Like I asked my clinical instructor, like, I don't think I should do this, or I asked another nursing student, for example, like even like OB, right? Like a lot of guys feel very uncomfortable when a male nurse walks into the room,
especially when he's younger. It's not like an old man or a doctor.
And you get to like feel like assess, and it's just kind of awkward. And just certain moments, like a Foley on the, just things like that can just get a little weird. But I mean, you're the nurse, you got to do it no matter what. So, but yeah. It could be interesting though.
And I think too, that's also like a good point. From my personal experience, when I go to the doctor, I prefer a female doctor. And I have had a lot of patients who are females, and they're like, I don't want like a male nurse or a male PCNA. And then I think too, older men are like, middle-aged men, they don't want like a young teenager coming in, a guy coming in, they almost would rather have a girl. So it's kind of like, maybe, you know what I'm saying though? Like, because a dude probably be like,
yeah, that's exactly.
That's weird,
There's certain things that wear like a bed bath, which is a very common thing in nursing school. Like if you're a girl, it's fine. If you're a guy, they usually like they want women most of the time, but a guy with a girl giving the bath, or a guy with a male giving, it's just.
I'd rather have a female do it, me just to be more comfortable. And even if I'm an older lady, like I feel like I'm gonna be one of those older ladies who's like, can I have a girl or something? But sometimes there's not enough people working, and I think it's too. I mean, he's gonna be around so many girls, and he's just so good looking.
Nah, I'm ugly.
Good luck tomorrow in your first clinicals. For applying to nursing school, definitely take your prereqs seriously and try to keep that GPA up as high as possible. Your prereqs do matter. Is it hard to find a CNA position at a hospital? I'm not sure. I feel like it obviously depends on the hospital, depends on the area. I feel like now they're needing them though, so I don't think it would be as hard because a lot of places are short-staffed because of COVID.
I think it's always nice to have a referral.
Yeah.
If you know a nurse or someone that works at the hospital that can refer you, it's always very helpful.
My eye
fundamentals tips.
Wait, where did you see that? Oh, farm. Listen to your lectures over and over again. Use a dry erase board. Write things out. I try to remember stupid, different, I don't know, mnemonics or anything to help remember. I know registered nurse RN too. I think she does like medication videos too. Keep touching my eye, my contact. Kayla, you're so nice. I'm so happy that I can keep you motivated. That's so awesome. So
red's my favorite color.
Can you guys guess my favorite color? It's pink and glitter, glittery pink. Well, it used to be maybe more.
She used to ask me what was her favorite color like every other day. To see if I remember. Yeah.
Oh, what's my favorite color?
You used to always ask me. You guys meet each other's parents. What was both of your reactions? Yeah, we met both of each other's parents. It was cool. Their parents are cool. Good vibes.
His parents probably thought I was just another girl coming to his house.
Nah.
Well, and then I came over more than once, and they're like, "Oh, you like her?"
They like her. Yeah, very fond of Maddie.
I really like his parents, and his stepmom actually. She's a hairstylist, and she's awesome. She did my hair before And then, oh my gosh, there's literally, I don't know if there's an eyelash in my eye, but I'm dying over here.
Where did I put my
Is there an eyelash?
watch?
Oh my god, there is an eyelash in my eye. You guys, that's why my eye was hurting so bad. There's an eyelash in my eye this whole time. Have you seen anyone from your job graduate with their EDN and have trouble finding a job? I have not. And I think it's maybe because of the whole everything that's going on with the world right now. But no, I haven't seen anyone have trouble getting a job. I feel like there's a lot of places hiring. You are so nice. I'm so happy that my channel can help you. You guys literally are so nice because I definitely lose motivation, and I feel like you guys motivate me so much. And I think something too, at my nursing school, you can only fail like one class and then you can retake it and you can't fail another class. And so if I fail another class, I'm out of my nursing program and it's a lot of pressure. And then I feel like I'm like, okay, I have 65,000 plus people watching me. So I feel like I put so much pressure on myself because I don't want to let you guys down. And it's a lot. But at the same time, I feel like it helps me, really pushes me because I don't want to let you guys down. Because I want to work hard because I know that you guys work hard. So did that make sense? I don't know. I'm tired. I was supposed to write an essay tonight to fill out for an application thing, but I really wanted to talk to you guys. Hi, is it Manal? Hi, I love you too. Hi, Scarlett. Ooh, Roselle, your next clinical is OB. I'm so excited. So hopefully we love it. I love you, Chantel. You're so nice. Your name is so beautiful. Oh my gosh, Chantel is such a pretty name. You guys all have the prettiest names, and my name is so boring. Vanessa, my teas experience, it literally wasn't bad at all. My very first video is actually talking about the teas. I don't remember my specific score because I took it in 2018. So it's coming up on 3 years, which is crazy. But I didn't do horrible, but I don't think I did like amazing. I did like average. So yeah. Oh my gosh, that is such a good idea, Kaylee, to do a live study session. That'd be a good idea to film like a live study session. We film it. Oh, ew, was that today?
Yeah.
Oh my gosh, gross. Oh, he's showing you his detail.
This is the car I detailed today.
You have to put it up. Yeah. They can see it. But yeah, I'll definitely, that's actually a really good idea. You would do a study with me, a live video, and we could study live in person. Oh, did you edit it?
Yeah.
Is there a video? A picture?
Oh, pictures.
Oh my gosh. Wait, is there before and after?
Yeah. Look at that. Oh,
What the heck? What is that? Lobster?
No, like the kids put the candy
Oh.
and it literally sat there for like years. They just never cleaned it out. Oh God.
Ow, you hurt my leg.
Sorry.
Are you showing them the after? Ooh. Oh, that looks really good, babe.
So hard to see.
They can see it.
All right, that's good enough.
Do you think GPA and class rank in high school can determine your knowledge in college? No. No, no, no. I mean, I'm sure maybe it could, but honestly, I don't think it does. Personally, for me, because no.
Not at all.
Yeah, no.
No.
You are. Aw, thank you. You guys are so sweet. Thank you so much, everyone. Good luck, Christina, taking your entrance exam. It's normal to be nervous, but definitely make sure that excitement, just hold on to that excitement and try not to get too nervous. I thought my car was bad.
No, this one's terrible.
He does see some crazy stuff, but
Where are you? I need the detail.
it looks like a new car.
Cleveland.
Cleveland,
Ohio.
Any recommendations in Wisconsin?
Yeah, with that. You guys want to see some satisfying
little
videos? Hit me.
plug in here.
So you got some crazy photos. Video.
If you want to be a child doctor, do you go to nursing school for that? So no, you would do for your undergrad. So your first 4 years of college, you would do something. I think you can major in like biology, nutrition, and then you would apply for medical school and go to medical school for that.
You could be a peds MP if you want to do nursing.
Is that a lobster? That's what I said. Oh my gosh, everyone's like, yuck, it's so dirty. Yeah.
Terrible.
Have you guys ever thought of doing a joint channel?
That'd be cool, but I don't know if I'm cool enough for a joint channel. She obviously is can do YouTube. I don't know if I'd be good. I don't know if people want to watch me.
Just kidding.
I don't know.
Yeah, I think probably I don't know how people have multiple channels. This is a lot of work, so I think he would just stick to being on this one.
Nah, I'm gonna start my own one. Antonio's
They're gonna
nursing
They're gonna
journey
like you better than me.
coming.
Watch out. Victoria says, I'm in Texas. She's coming to Ohio.
Say less. I'll hook you up.
Yes, I am interested in OB when I become an RN. Oh, drop the ad for your thing, for your Insta.
Oh.
All things fresh.
All things fresh. So.
I know. Oh my gosh, you guys. So I don't know if I mentioned this in a video before, but we filmed a nursing school relationship Q&A video back in, oh my gosh, I think it was June, and it was like 2 hours long, and I edited it, and I was like, you know what? I don't like this. So hopefully we'll film it again this summer, maybe? I don't know. It's hard. I got upset today because...
Have you ever been in New York?
No. I today because he was going to study and I wanted to hang out, but I don't have to study right now because I just finished my finals.
I have an exam. I have to go through all these NCLEX questions still. It's so much. It's crazy. I've been in New York when I was like in 7th grade.
I was supposed to go to New York in... I think I was supposed to go to New York last August. We were going to, me, my mom, and my sister for our birthday, we're going to do a girls trip because we'd never done like a girls trip with the 3 of us in August. My mom said we could choose between New York or Chicago. I wanted to go to New York. My sister wanted to go to Chicago. So anyway, but the pandemic happened, so we didn't go. But hopefully one day I'll get to go. I just followed his Insta to give him motivation to keep my car clean. I'm so excited for the weather to get warm here so I can clean my car. Oh, it's so nice to just get in like a fresh, clean car. Congrats, Sia. That's awesome. Wow, everyone has such pretty names. Do you get to do your clinical fully in person? Yep, both of our clinicals are in person. Except his OB clinical is going to be online with like a simulation thing. Jay, you are so sweet. Thank you so much. And literally, do not say that you don't think you're the greatest person. I feel that way a lot too, but you literally have to believe in yourself. And you are so much more capable of doing way more than you could ever imagine. You really...
Look, you want to talk about, like, I'm telling you, even if you don't think, a lot of successful people, so I detail for a lot of people, a lot of successful people. I'm telling you, it's not about how smart you are, how book smart you are. Not even close. I'm not that smart. People will tell you I'm very...
You're very what?
Like, spacey. I can get spacey. Yeah. That's one of the things I won for my high school, you know, like the award things. Senior, yeah, I got most spacey for one of them. Whatever though, you know, that's how it is.
And I think that's the thing too. Again, at the end of the day, like based on your grades in nursing school or whatever you do, like you could literally have the best grades in the world and you could be like a horrible person, or have the straight A's in nursing school and not even know how to interact with a patient. So
how's that a super? I know, right? I think they made it up for me. They're jerks. They're hating on the boy.
He also got most attractive in that smile, but
Nah. He's defining new Gemini trait.
Gemini tree. Yeah. Well, when he gets like, I feel like when you have a lot going on, he can like space out where it's like, are you hello?
Just have a lot going on in my mind. I'm always so busy that I
Mhm.
just space out. Like I'm always thinking of something, a goal. I'm a motivated person. Forgot I was
Yeah,
making
I
cookies.
feel like. Oh, are they burning in the
I
oven?
just preheated the oven, but
Oh.
I didn't make them yet.
I think the RN pay depends on where you work per state. It's literally so different. So I would definitely look up for your state. Spacey, love that word. I'm a senior in high school. Any tips, by the way? I love your videos. Thank you. I would just try to figure out the rest of your senior year some good. Wait, look, I'll keep myself. So. Wait, my sister got them for me. They're a little Oh my
Oh
god!
yeah, you
Ew,
could
is there,
you
like,
could definitely
grass?
work full time, be successful in nursing school. Somebody in my third semester right now works full time. I know a couple people in my clinical group. It's just like you set the time manage really well. It's hard. It's definitely possible.
Yeah. Oh my. Why is my eye burning so bad?
I graduate. My favorite snack, Sour Patches. And I graduate in 2021, December 2021.
Yeah,
So
I
does
don't have a
she.
specific date, but do you have eye drops?
No.
You guys, I think the lash was getting in my eyes or something. Yeah, nursing is competitive, but you guys definitely can do it. Oh, back to the senior in high school. I would definitely try to get a good study technique going that works for you. So when you transition into college, it's a little bit easier because a lot of people go from high school to college and they're like, oh my gosh, I studied this way for so long and now I have to kind of switch it. So I would definitely, figure out, are you more of a visual learner, an auditory learner? What were your graduation for high school? Oh, graduation dates. I graduated. Oh, wait, high school? High
Yeah,
school.
high school.
I graduated May 25th, 2017. And
I graduated in 2015.
no, I'm just kidding. And I had my graduation party the next day, the day right after, because my mom wanted to get it done and over with. And I left my own graduation party like early before it ended to go to a future concert. And I had a horrible time. But anyway.
Didn't really study in A&P. A&P's tough. I took it in high school for a college credit, and it was so easy. It was near as hard as taking it in college. I got super lucky with that.
Victoria, you are so sweet. Oh, you're so sweet. Oh my gosh. That's like, I can't believe that you think I'm inspired. Makes me emotional. Makes me happy. So thank you so much. That's just crazy. I have a whole video to study for the T's. I took it so long ago, I kind of forget, but it's like my first video on my channel. I have tips on there. I think I used like an app in the T's book. Ow.
Oh, what the heck just happened? Your hair is like on my
Oh
hair.
God. ATI. Yeah, some schools don't do ATI. Some do. She's a good reason to leave your graduation party. Go hard, senior. I feel like nursing school, it depends on the nursing school. Definitely where you're applying to. Some have waiting lists, some don't. Some have like X amount of applicants and only take 1/3 of them. It really depends on the school. You definitely have to,
Wait, you're 30?
research it.
No.
Oh no. He's not 30. Someone in the comments said that they were 30.
Oh.
Is your boyfriend going to Ohio State for his BSN?
Oh
Are
God,
you going
no.
to OS or you're gonna
I'm going to OU
yeah,
probably.
so there's Ohio State University, which is in Columbus in Ohio, and then Ohio University, which is in Athens. So they're two different schools. Ohio State, I'm sorry, the Ohio State. People get really mad when you forget the. It's a really like I don't know, it's like a school a lot of people want to go to in Ohio, but OU's different, but we're both getting it through OU.
We've been together for a year and some change.
Long year. We've only been together though through I feel like quarantine, huh? Or like through this whole
Maybe a quarantine
we started like
relationship.
yeah.
COVID relationship.
Marilyn, what was the hardest class in nursing school in your opinion? Well, congrats for getting accepted into your program. That's so exciting. It's gonna be a long journey, but it's gonna be so fun and so worth it. The hardest class I've taken so far is like pre-nursing, it was stats. I hated stats. But maybe in nursing, I don't know. I guess fundamentals was the very first class we took, but it was kind of like,
Oh no, mine
I
too.
don't know, it was just boring.
Fundamentals too.
No. Oh no, my med surg 2 class was so hard. It was so hard, but I learned so much. It was definitely the hardest class, but it was
You could
the one
be
I learned the
anywhere in
most.
the world after the virus, where would it be?
In my arms.
And, I don't know.
Me either. Oh, I've always wanted to go to Italy, so probably Italy, or maybe somewhere like tropical, like Bora Bora. And I'm
Technically, you
also
can go
too
right
poor
now.
for that.
Okay.
Mm,
We have 6 divided quizzes, so you get an exam. Oh, food! My gosh, that's rough.
oh my goodness.
Eventually getting through school.
Praying a lot, taking my anxiety medication, and positive self-talk. I tell myself every day, this is what I say. I'm smart, I am strong, I am loved, I will pass. And I say it multiple times every single day out loud. I write it down in my planner and I write it out and I say it every day. I'm smart, I am strong, I am loved, I will pass. And I say it all the time and I feel like it's helped me a lot.
Don't take life too seriously.
Thank you.
It'll be alright. You know? The more stressed you are going to your test, the worse you're going to do. Just easy breathe. How do you to not cry over a bad grade? I feel like everybody cries in nursing school.
Yeah, if you saw the vlog I just posted, there's like a clip, and I literally just recovered
doing
from
that
crying.
Gemini thing. Ah, God. Am I?
What's your Gemini? Oh, you're like, Greece. We want to go to Greece so bad. We think we are talking about doing like Santorini for after graduation.
Yeah, that'd be super dope. Santorini, that'd be
Oh my gosh.
awesome. Live in the moment, Gemini. Oh my God, you guys are killing me.
Do you guys?
Maybe I do.
Do you guys get dust? I don't know what that means.
Do you guys get distracted if you stay next to each other? I feel like we take multiple breaks.
Yeah.
To like.
I'm like, oh, I need attention. I'm dying. But yeah, normally we sit in different rooms.
Finally, somebody on the Gemini team.
There we go.
Nice.
Definitely visit Rome. Rome would be awesome.
I want to go to Hawaii so bad.
30 hours a week.
So gorgeous.
Oh yeah, I've definitely cried. I haven't cried as much as I thought I would. Babe, you keep ripping my hair. I've not cried as much as I thought I would in nursing school, but I definitely have breakdowns each semester. Bianca, you are so sweet. I'm so happy that I could help you get organized. You're so nice. Michaela, I'm so happy that I can help you get your shit together. I feel like I don't have mine together. I try, but
I sure don't.
No, it's
I think you never really do. Nobody really has it together in nursing school.
No, and no one
Honestly,
in life.
They said they do, they don't. Nobody's always in nursing. It's tough.
Yeah.
Nobody always has it all together.
Even
right now I'm supposed to be studying, but I'm not. I have an exam tomorrow. And only have 3 exams, and that's my score.
Like you're in my nursing school.
I know, right?
What is your ethnicity? Well, I'm assuming you're asking Antonio.
Well, funny story. My grandma just did the DNA testing,
like the ancestor,
ancestry. So I don't know. I think I'm Puerto Rican and Irish or Italian. I don't know.
Which we thought was so funny because he doesn't look it,
Yeah, I know, right?
It's probably a super small percent, though.
Yeah, probably not much, but mainly just Puerto Rican.
And then I am German and Dutch. Super exciting.
I never knew that.
Yeah, German and Dutch. Last name is Van Dyne. So,
You speak Spanish? Nah. Funny, people always come up to me while I'm working in the hospital, like, and like, can you speak Spanish? Can you speak Spanish? I was having trouble. Can you? No, I don't.
well,
I wish I did.
And then, other side note,
just-
you get mistaken a lot at the hospital if you're Greek, right?
Yeah, a lot of people at the hospital have asked me, am I Jewish? Am I Greek? I've gotten mixed.
Mm-hmm. But you have a little bit of black too.
Technicality, but not.
Just
My
his
mom. My
mom.
mom was a quarter, but
Mhm.
not much. I don't know what that means. Like
He gets
10%.
literally the beautiful, the most
She's gassing me.
beautiful bronze skin in the summertime. Oh my gosh.
I get pretty dark in the summertime.
Yeah, he does, and he just looks so just beautiful. And then let's see, your future babies are gonna be so cute. If Ellie and Nick, oh my god, it'll be like, oh.
Hopefully so. Hopefully so.
Yeah.
Let's hope the kid has blue eyes.
Ellie and Nick's or ours?
Ours, because I have blue eyes in my family, but it just didn't get past me. My eyes are like dark.
I think it'll look cool with like black curly hair and like blue eyes, but I love brown eyes, so I would not be mad at brown eyes. But thank you, Sophia. You are so sweet. Oh gosh.
My next exam is on schizophrenia. Well, she's just finished, but my exam's on schizophrenia and therapeutic communication. Something like that.
My freaking eye. My eye. Okay, anyway, I'm done talking about my eyes.
Gosh, I need no practice.
What self tanner do I use? So I use Loving Tan. I'm obsessed with Loving Tan. I actually tried, I think it was the Bali tanner maybe a year and a half ago. I was like, let me just get a couple to like try. And I don't know if I got the wrong color, but it looked I didn't really like it. But I love Loving Tan, but right now it's bad. But I went to the tanning bed to get some color on me before vacation. So yeah, but I use Loving Tan. It's like my go-to. I love it.
Brown eyes don't get enough love.
I'm obsessed with brown eyes. I wish I had brown eyes so bad. Like brown hair and brown eyes, like the perfect thing. Yeah, I just think brown eyes are so awesome. Everyone's like, oh, I hate my brown eyes. Like I would trade my blue eyes any day for brown eyes.
You get all these NCLEX questions that you get before my test tomorrow.
Here, wait.
Whoa.
Oh my gosh, you need to go study. Oh my god, you need to go study. It's 12:06.
That's 77 pages on Google Docs. It's at 10. But I feel pretty good though. I feel pretty confident. These are just like supplementing, just the knowledge.
I get my nails done tomorrow at 9:30.
What's your passing? 78%.
What did you say? Oh, passing, same thing. Oh, mine's 78%
she's going to bed,
too.
so she needs to answer ACE. 78%. Do you keep in touch with your high school? I listen to hip hop and R&B and pop.
What?
I listen to a lot of music. I like a lot of music. If it has a good vibe going, I'm listening to it.
I'll pull up my Apple Music in a second to tell you guys because I love music.
I got no preference.
But
it's vibing is vibe.
I talked to Paige, Kelly, Lauren, my own twin sister. I talked to 5 people from high school, and that's it. And I'm completely fine with that.
I don't talk to anybody from high school.
Yeah, I'm so fine with that. Let's see. Okay, so I am obsessed. I like every genre. Some of you are gonna hate me, but I don't like country. I really don't like country. I like a little bit of Dan and Shay and a little Luke Bryan, but that's
you guys like K-pop? What that is?
K-pop.
What is that?
I don't know.
No.
I've heard of it before, but I don't know what it is. I am obsessed with Jack Harlow's new album. He is so good. Listen. I don't want to get copyrighted.
Oh yeah.
I am obsessed with Jack Harlow's new album. It's so good. 21C/Delta is really good, but Already Best Friends with Chris Brown is amazing. I love Post Malone.
Sorry, that is a good one.
I like ASTN. I like.
Thank you. It's really good luck.
Russ, I love Russ. Hate his personality, but I like him. I like his music. Justin Bieber, Georgia Smith,
Chris Breeze,
Drake. Oh wait, you asked genre. I'm just telling people. Dua Lipa, St. John, I love St. John. Let me just tell you the underrated artists, my top ones I like. St. John, I love him. I found him before he got like crazy famous from the Roses song on TikTok. I love his music. It's amazing. Jaden Smith, love his music. Magic Jordan, I would literally cut off my pinky
Any bad ball?
to go to one of their concerts. And St. John, what did I say? St. John, Jaden Smith, Magic Jordan, Jack Harlow, his new album. I don't really like much of his other stuff. And then I think that's yeah. Oh, I like Billie Eilish too. I don't know a lot of her songs, but I like her. Yeah.
Drake.
Good night, Roselle. Do you feel because you're in the medical field, you're more aware of the healthy life habits versus unhealthy ones? I think so, but I also eat horrible still and don't take care of myself. But I feel more guilty about it because you know more, and then you always diagnose yourself. Like you think you're dying. Like I had like one day my nail was blue. I'm like, oh my gosh, like cyanosis or something. Like checking my capillary refill and stuff.
That Bruno Mars song is fire.
I love Chris Brown's music. I had mine today on Circulation Shock. Well, I hope it went well for you, Bianca. Ella May is so good. I love her. She's beautiful. Her music is amazing. Her voice. Any Bad Bunny? Bad Bunny. Isn't that the one song you told me about?
Mm-hmm. Yeah, I like Bad Bunny. Man, about this.
Primo Blue. It's a vibe. I don't know that.
Some people go to school to get their BSN. Just go straight, like 4 years. I personally, you can go to get your ADN, work at a hospital, and have them pay for your BSN. But to each their own, I think it's more financially
smarter
smarter probably to get your ADN and have the hospital you work for pay for your BSN, or at least half of it, and then you can start working and making money already as ADN. You have to get your BSN in like 2 years or something like that.
Yeah, I definitely think too the ADN is a smarter way to go, saving money wise. But
to each their own.
To each their own. Definitely, I would look into it more yourself and see what works best for you. Yeah, there's definitely moments where I feel like I'm not picking up the information. I'm like, oh my gosh, how are they understanding it? Are they answering the questions? And normally when that happens, I'm like, okay, I need to go to like really look at stuff because I don't want to like. I'm like, oh my gosh, I feel so dumb. They're picking this up so fast. Like I remember when we were first learning, just an example, like dimensional analysis or like acid-base imbalances, if it's metabolic alkalosis, compensated, uncompensated. I was like, what? So I had to really go home and practice it. But it kind of pushed me more that I didn't know what to go and like push myself because other people knew it. Thank you, Jocelyn. You are so sweet. I'm so happy that you like my videos. Thank you. If I wasn't in nursing, what would my major be? Definitely something with criminal investigation, law, private investigation, something with criminology and like investigation stuff with like crime scenes and stuff would be really cool. Or stay-at-home mom. That'd be fun. No, I'm just kidding. I mean, it would be, but I also think I'd probably like lose my mind if I was stuck with the kids all day. Not that I have kids, but share your playlists, please. I don't know how to share playlists. I'm gonna look up.
No, either.
I don't know either. Like, because I don't have a Spotify. First off, I never knew how to work Spotify, but I have Apple Music. So let me figure out how to do that, and then.
You guys plan to get an advanced degree? Ooh. I know she does.
Yeah, he's into real. He just has to. He finished all his real estate classes too, so he's getting his real estate license, and he has his own detailing business, and he has a lot of stuff he wants to do. So he definitely doesn't want to be a nurse for the rest of your life. Wait, was that the question?
Like an advanced degree.
Oh,
like,
advanced degree.
You can always be. I think I'd rather be PRN eventually, and I'm very interested in real estate and all that, and my detailing. So it'd be cool to be a nurse practitioner, but
yeah.
Tony like watching true crime with you. You watch true crime? Do you?
What do you mean?
Like the murder shows?
Yeah, that's what it is.
Oh, that's what true crime is? Oh.
Yeah, like more in like real, like actual cases. Like, I feel like it
Mm,
was like a crime show, The Sinner, but it's not like true crime. It's like fictional.
yeah,
But
that's
he's,
for
you
sure.
know what he watched with me? What was the Lacey Peterson case?
Yeah,
Yeah.
yeah, that was nuts.
See, he doesn't really watch it, but I got him to watch the Lacey Peterson one on Hulu, and he stayed up for like until 7 in the morning finishing the series. He
We
was like,
started at like 10 and I
I
stood
like
up
fell
till like
asleep, and he was like,
6.
it is so good.
It was
So
so
yeah, but he will sometimes. Sometimes he's like, oh, like, can you put your headphones in? I don't want to hear it or something. But
case is
yeah,
crazy. So crazy.
yeah.
So good.
Or a URL of the playlist. Yeah. I gotta figure out how to do it, and then I will let you guys know. But best true crime series. That's a good question. I don't
Lacey
know.
Peterson was good. That's like the only
See,
one
I
I've
fell asleep. I
watched.
didn't finish it, and then
So freaking
I
good.
am fascinated, completely fascinated with the Charles Manson case, the Manson family, the Tate LaBianca murders, that whole thing. I did a whole sociology deviance project in high school, and I put my blood, sweat, and tears into that. Amazing. My project was amazing, not the case. It's very interesting. So any shows that are on the Manson family is so interesting. It's like crazy how manipulative one human can be. Not really a human, an evil human. But honestly, I just watch like true crime YouTubers as well. And then anything on Netflix, I watched the Cecile Hotel documentary. I watched the Ted Bundy tapes, or no, was it the Ted Bundy tapes? I watched the ones not with Zac Efron, the actual like documentary, also the Night Stalker one. If you I watched the Night Stalker case, Risha Ramirez, Bailey Sarian did. She's a YouTuber, and that was probably one of the most like affected I've been by like a story. It like made me sick to my stomach. But yeah, I do not watch The Bachelor, but all of my friends do. I don't watch it. We're both in nursing school. We're not nurses yet. Are my favorite show on Netflix right now? I don't have a favorite show right now because I haven't been watching anything recently. Um, mm, I think I have heard about the Silent Twins. It is crazy. Yeah. But oh my gosh, I can do a whole video talking about the Charles Manson thing. Like that would I would love to do true crime videos on here too, but I don't think that's my audience. But I could do like a whole video or something. You should look it up. It's very interesting. Um She's Victoria said Gemini. There he goes again. Why do y'all stay up in the dark hours? That's the other side, the twin shadow. See,
I'm a night owl.
you are, but he can fall asleep so fast. Like we'll lay down or he'll be
Yeah, I
talking and
could
one
knock
second later
out.
he's sleeping.
I'm definitely a night owl though.
Me too.
I operate best at night. That's like when my brain starts.
That's what I was saying. I study more at night. But yeah, but I'm getting tired, you guys, and I have to be up early to finally get my nails painted. But I love you guys, and I'll definitely do this again because I always have so much fun with you guys. And yeah, I love you, and I will see you guys. I did see American Family Murder. That was heartbreaking. Um,
Yeah.
but yes, I love you guys so much, and I'm definitely going to do this again. I hope you guys have an amazing night, a good rest of your semester. I'm sending you guys so much love, prayers, and good luck. And I did post a new vlog if you didn't see, so definitely check that out. And hopefully, I'll be posting a lot more. So I love you
Don't take life too
all.
seriously.
Thank you.
Just relax.
Don't take life
Have
too
fun.
seriously. Relax, have fun, take it day by day. And yeah, I love you guys.